Hi everyone and welcome. My name is Rachel Underbaki and I work here in the Research Institute Administration at Seattle Children's Research Institute. I hope all of you were able to attend the amazing fair yesterday at our Building Cure location, and we are excited to be hosting today's summit as well. We are proud to partner with Carolina Summer, who many of you know and will hear from shortly, as her passion aligns with our mission to help kids live healthier lives. In fact, by nature, that they affect children, by definition, most pediatric diseases are rare diseases. With a few exceptions, the majority of today's event will be recorded and shared out after. But first, I wanted to let you know who we are. Seattle Children's has been a part of the Seattle community since 1907, providing care to children regardless of their ability to pay. Our research division is nearly 17 years old and is closely connected with Seattle Children's Hospital. Both are supported by our amazing foundation and the community in the Northwest and around the country. Together, we all work towards our ultimate mission to provide hope, care, and cure to help every child live the healthiest and most fulfilling life possible. At the research division, that means leading or supporting research of all types in a wide range of fields, from the impact of media use on children's development to our groundbreaking cancer immunotherapy to dozens of projects related to COVID-19. We are proud to be part of this event where you are all putting your heads together to move in that same direction, to help kids live healthier and more fulfilling lives.
I'm Joshua Henderson, with Carolina Summer and Max Brown, one of the co-founders of the Northwest Rare Disease Coalition. This is a 501c4 nonprofit whose mission is to support Washington's rare disease patients, their families, and caregivers, really in three ways. First is sort of all things policy related. Second, around education. And third, programs just like this one and the fair yesterday. This organization was really born out of the fair a couple of years ago, and really a desire to continue to connect and engage and support the community kind of beyond one annual conference during the year. We focus on kind of three main areas: ending the diagnostic odyssey, accelerating research and the development of new treatments to rare diseases, and improving access to care. And in order to develop these solutions in these areas, we form task forces and bring together different stakeholders, whether that's patients, caregivers, industry, hospitals, government representatives. And as you participate today and feel inspired to get involved, we'd love to have you. Yesterday, one of our speakers, Shelley Egan in Medical Affairs at Pfizer, shared that on her desk is a quote from Walt Disney that says, "It's kind of fun to do the impossible." And I think to do the impossible, we need all of you. So whether that's joining a task force, starting a task force, signing up for our mailing list and sending some emails to your legislators, joining us when we go to Olympia to advocate, there really are so many ways to participate at all different levels and time commitments. So we'd love to have you. We'd love to have you contribute in any way that you can. And really with that, I'll pass it over to Carolina Summer. She's, as I mentioned, co-founder of the Northwest Rare Disease Coalition. She's the founder of the Born a Hero Research Foundation, founder of the Rare Disease Fair and Summit, and a rare mom, and probably someone who needs no introduction to all of you. So with that, Carolina, over to you.
Thank you so much, Joshua, for the welcoming speech and just for all your hard work. I just love working with Joshua. I don't know, he's just so wonderful. And thank you to Rachel and the Seattle Children's team for everything and all your support. Yesterday was a great day indeed, Joshua. I like what Max said. You feel the love in the room. So, and I love that. It was a great day, and today's going to be a great day. First, I just wanted to start by thanking our sponsors really quick. Seattle Children's Research Institute, Pfizer, Pharma, Illumina, Vertex, Ultragenyx, Alexion, Mozi Therapeutics, Regeneron, and Decimum Consulting Groups, Born a Hero Research Foundation, and the Northwest Rare Disease Coalition. The first section of the conference is going to be on challenges faced by patients, real stories, and advice. As you know, mental health is a big challenge even in our community, but especially I think for our rare disease advocates and caregivers. Check out our mental health program at www.northwestrare.org. You can see our mental health program there, or contact Carrie or Christina if you want to join the mental health task force. We have some exciting projects ahead of us, so please join if you're interested. I would like to introduce the next speaker, Kara Jackman, who is the Children's Craniofacial Association Adult Program Coordinator. She runs groups for adults and caregivers for CCA kids, and coordinates with other nonprofits like Connect Med International to support their work with adolescents, young adults, and caregivers. She has been actually having some health issues, bless her heart, because she showed up today. And so I'm just, thank you especially for that. She will be sharing the patient perspective on anxiety, depression, trauma, and tools. So grateful to have her because things are often not talked about. And these conversations are so important to have. And I really love how Kira is so authentic about all these things. So I'm really grateful to have her here. Thank you. I'll let you take it from here.
Thank you so much, Carolina, and all that are involved with this. I actually am struggling with some mental health issues as we speak. And like Carolina says, I like to keep it real. I like to be authentic. This is what it is, and this is how mental health goes. So I'd like to share about my anxiety, depression, trauma, and then I'd like to share one tool with you that I found very helpful and continue to find very helpful. So yeah, that's kind of our agenda. And then, like I said, we'll have a tool. Thank you so much. So I was born in Boston, Massachusetts, all the way across the country from you all. I hope to get out there someday. So I was born in 1979 with a severe bilateral cleft lip and palate. You can kind of see in the diagram there, in the animated diagram there, what the inside of my mouth and the exterior of my nose looked like. I went through 5 surgeries before my first birthday. I began exhibiting obsessive compulsive disorder symptoms and anxiety symptoms as early as age 3, as I recall it. It could have been before then. I still do kind of play with my hair, but I used to pull my hair out from my head, which is called clinically trichotillomania. And in talking with many folks in our community, other people struggle with this. It's a common disorder under the OCD disorder umbrella. I used to pull my hair out and then play with it, put it in my mouth where there was like scar tissue because those areas were sensitive. I have other OCD symptoms, including intrusive thoughts, rituals around food, germs, the bathroom, etc. I remember the first time I was depressed as well. So I had really intense sadness. My mom was, in shopping in a store, and I was in the car, and I was holding my Raggedy doll, Ann doll, and I just remember being so profoundly sad. Not just crying sad, but like just at a soul level sad. So that was shocking to me, and it still is. As time went on, anxiety and depression continued to plague me. And I also acquired PTSD from all the surgical interventions and my sometimes unpredictable home life. I began therapy at age 8, but was in and out through the age of like 16 or so. I've been in continuous therapy since the age of 17. And at age 18, I trialed a number of different SSRIs, benzodiazepines, and other medications to help support my mental health. I had panic disorder. I would have these awful panic attacks and not really know what they were until I was told when I was 16 or 18 years old. I am currently, as we speak, in inpatient care for some additional stabilization of my medications right now. And so as I share this presentation with you, like I said, I like to keep it real. I have one more week where I'll be monitored and stabilized and working toward getting back to my life. I am a very successful woman that is not ashamed of her mental health journey. If I had a broken leg or if I needed another craniofacial surgery, I would be in the hospital for surgical care. This is no different. And in fact, I find it far more important. So why am I telling you this? Why is this important? Because addressing mental health is, in fact, life or death. Unlike the broken bone, the broken leg, this is life or death. So just to throw some quick stats at you, 1 in 5 Americans will experience a mental health illness in a given year. That's from the CDC. And 1 in 7 Americans aged 12 or older reports experiencing substance use disorder. And that includes alcoholism, drug addiction, etc. This is a matter of life or death. I really do believe that, because especially those in the craniofacial community, we're exposed to addictive medications, anesthesia, and things, and just things like that from a very early age. In looking back at my medical records, I was given phenobarbital at 3 months old, at 6 months old. And that's basically what we now call an opioid. To compound these issues, we experience bullying, teasing, and are approached by our peers with questions we cannot answer. Our self-esteem takes a tremendous amount of hits. Additionally, we find ourselves in traumatic medical experiences throughout our lives. Meanwhile, our caretakers also suffer as we go through these surgeries, scheduling medical appointments, advocating for the best possible care and outcomes. And all of this leads to burnout and leaving them more liable to become anxious, depressed, and depleted. Mental health truly is important to all of us, and especially those of us in this community, in this rare disease community, and also the craniofacial community. So what can you do? While I like to talk about my past, present, and future, I also want to be in the solution. I want to provide tools to people. So one way is to utilize a safety plan. I created mine back in the day on a 3x5 index card, and I find that much easier to manage, because you can put it in your wallet, you can put it in your backpack, your purse, in a book, wherever, so that it's readily available to you. It's such a small thing, but it's like everything. And that's what I love about it. You could also do this on your phone as well, because now, when I did this initially, I don't think we had smartphones, so you can do it on the 3x5 index card, or you can create a note on your phone's notebook app and put it there, and that will make it also readily available. It's whatever you're comfortable with. And then again, the template is helpful both for children and for adults and caregivers. So take a look at that as a way to organize information. So the safety plan is going to have a few different elements, and these are organized by category, just to give you some ideas as to what to include. And then this is a good way of communicating and reminding yourself, but also reminding and communicating to others what you need when you're in a panic attack, or when you're in a depressive episode, or when you're just having a hard time or overwhelmed by emotions that they may be positive or they may be negative, depending on what your particular mental health issues are. So include a list of triggers that can be people, places, events, emotion states, and body sensations. And you can also look at other things that you particularly find triggering as well. list 3 ways to distract. Like for me, there could be watching TV. I'm sorry, that second one is not accurate. That was part of the slideshow template. So it could be list 3 ways to distract. So that could be watching TV, playing video games, any writing, reading, any activity or exercise, any activity that or means by which you can distract yourself from how you're feeling. So it's kind of a distress tolerance. Other things, activities that may help me cope. So that can be journaling, that can be drinking more water, or having a cup of tea and really experiencing all of your 5 sensations and having them focused on and in that moment. I also love the idea of comfort objects like a dog or a cat or some other pet, a stuffed animal, a weighted blanket, or just your favorite blanket. And also writing and journaling to process and to get those thoughts, feelings, and emotions out of your head and onto a piece of paper. And then also, please do take a look at, and think about those things that work for you. And then finally, I like to make sure that people have a list of safe people to contact. So that can be caregivers or a parent, a therapist, a pastor or a priest if you're inclined to be religious, a counselor, a friend, a trusted friend that can handle and hold space for you, a psychiatrist. And I think my favorite one of late has been calling 988 or texting the word home to 741-741, and you will be routed to a person in your region that can help you kind of de-escalate what's going on. So if you're in a panic state or you're crying, you're just overwhelmed, this is a great way to kind of calm down, and they will talk with you and sit with you and even maybe go over some of the things that are in your safety plan. So, and then also just consider some other people or, organizations that you can contact that would work for you. 988 is just the best resource, and it's wonderful that they have the option to text, because a lot of times it's very difficult to talk when you're in these high emotion states. And then I like to always make sure that it's clear, like, for me, like your space and your environment, what are those needs like? For me, as of late, like I'm very light sensitive. So, I mean, I have a pair of sunglasses with me, so that like if I just cannot take it anymore, I put those on. Other elements of your space, does it have to be clean, neat, sensory friendly? Again, that change in light. Do you prefer it to be quiet, or, do you prefer a little noise? Or do you want to make sure that there's no sudden movements, no violence nearby, and making sure that like really loud noises that are unpredictable in nature are not happening near you. So, you may want to go to another room, depending on where you are. But again, I write here, just make sure that you do the things that work for you, and think about other things that you could, that maybe work for you in that category. So that is pretty much it. I wanted to leave a little time, if we have it, maybe we don't, to like get started on these, on your safety plan, either, on that 3x5 card or using that link. Please do these with your children. Please provide this as an option in clinical settings. I think, clinical settings can be very triggering, and this is a great tool for kids, for their caregivers, just for everyone, really. So I hope that, I hope that this has been helpful. I do. And I just listed my resources where I grab those stats from the CDC and where I got that template. So you can please reach out to me at my email, katejackman@CCAkids. Please check out our website. We have on ccakids.org. We have a ton of resources in our one sheet overviews about mental health and about coping strategies and dealing with going in for procedures and surgeries and medical appointments. And also read the CCA Kids blog, which I write for, and a lot of the articles that I focus on are on mental health because it's just is so important. Additionally, if you're interested in coming to either one of our caregiver circles, or if you know someone or are a craniofacial adult, we would love to have you at either of those. They meet once a month virtually online, and you can sign up at our on our website at ccakids.org. So I would love to see you there. Caregivers is coming up. Our next meeting is May 10th, and our next adults and alums meeting is the third Monday of May. So thank you so much for providing me this space and time, and I hope that you have a wonderful rest of your day.
Hey, Kara, I wanted to ask one quick question before I finish. For the 988, is that, like you said, is that just texting, or is there an option for calling?
So 988 is the number that you dial. It's like mental health 911.
And the other one is the text, the other
Yes,
option?
so the 741-741 number is the one that you text, and then you type the word, then in the body of the text, you type the word home.
I'd like to introduce my colleague, Allison Fine. She has been coming to the fair since 2017, our actual very first one. Allison is a very hard worker, and I just always in awe of all her work. So she's the executive director of the Center for Chronic Illness, which helps improve the emotional health for those impacted by ongoing health challenges and their loved ones. The organization works to decrease isolation and promote well-being for those with all types of chronic illness and rare diseases. Allison, for the past 15 years, has worked as a clinical social worker in private practice, nonprofits, hospitals, and senior living settings. Today, she's going to talk to you about mental health impact on rare disease loved ones. Thank you so much, Allison.
As Carolina said, my name is Allison Fine. I am a clinical social worker, and for the last 7 years have served as the executive director for the Center for Chronic Illness. And as Carolina mentioned, I've been coming to the Rare Disease Fair since the very origin, and I'm so excited to be here again. So thank you for inviting me. So I want to talk with you a little bit about caregivers and mental health today. And what I'll say as kind of a caveat is that this is a huge, huge topic. And so I'm really going to scratch the surface a little bit of all the information that's out there about the mental health of caregivers. But hopefully, this will motivate some folks to learn more about their own mental health as far as caregiving goes, or, if you have loved ones that are caring for you as the patient, encouraging them to get the support that they need. Okay, so I first wanted to talk a little bit about what is a caregiver. At the Center for Chronic Illness, we offer some programs for caregivers, but we decided a while back to start calling them loved ones. And so I'll kind of use those terms interchangeably during this presentation. And part of the reason for that is because caregiver is a very specific term that comes with a lot of thoughts and feelings and ideas about what that actually means. And so somebody might be doing caregiving activities, but they might not identify themselves as a caregiver. And so really, a caregiver is anybody providing care to somebody in some way. And, we might think of caregivers as people who care for older adults or, our parents as we get older, or we might think of a caregiver as a hired person who comes in the home and helps provide day-to-day care for somebody. But really it could be anybody. It could be a neighbor that runs errands for you. It could be a friend that brings you groceries. It could be somebody that takes you, to a medical appointment. So, really, I would encourage you to think of that term very, broadly. So we're going to talk a little bit about some of the mental health challenges that caregivers and loved ones experience. And I'll kind of go through these one by one. This is not a comprehensive list. There are a lot of emotions and feelings and mental health experiences that folks can experience while caregiving that aren't on this list. So if you don't fall into any of these, that's okay. Just know there are a lot of other kind of emotional experiences that people can go through as well. But I wanted to talk a little bit first about grief and loss. I always like to start my presentations out this way because we always think of grief and loss as the experience that we go through when we lose a loved one, when someone passes away. But in reality, the grieving process is really similar regardless of the type of loss that we face. And it might vary in intensity. If you lose a loved one who has passed on, of course, that experience might be more intense, but that doesn't mean that other losses you face, you're not going to go through some of these stages of grief or emotions of grief and have a similar experience. What I'll say is that 74% of our caregivers struggle with the loss of what their loved one's life could have been like. And so I would say that's probably one of the most common losses that we see, possibly because so many diagnosed with rare disease are diagnosed as kids. And so I think there's oftentimes when you have children, there's an idea of what you want their life to be like or what you might want for them in life. And so depending on their condition and the severity, that might depend on what their life is capable of looking like. And so, I think it's really valuable to know that, and again to know that some of these stages of grief, and I say stages, but they don't go in a particular order. But denial, shock, anger, bargaining, sadness, depression, acceptance. And we all experience loss in life. And so nobody is exempt from this, unfortunately. And again, we experience different kinds of loss. So just knowing as a caregiver that might be something that you're experiencing, or as a patient, that might be something that your loved ones are experiencing kind of for you or about you. So I wanted to also talk a little bit about depression. So there have been a lot of studies done about depression and caregiving, and it's a significant challenge for caregivers. So 40 to 70% of family caregivers report clinical symptoms of depression, not just one sad day here or there, but actual potential diagnoses of depression. And as you can see in kind of my long list of symptoms there, it can include anything from sadness, loneliness, anger, irritability. You might notice yourself snapping at a loved one or snapping at friends or, others in your life more than you would like. Any kind of sleep or appetite changes, negative thinking patterns, really common with depression. And then some more problematic symptoms like reckless behavior or even suicidal thoughts or actions. And so being aware that, we all have ups and downs, none of us, again, are exempt from having moods and, feelings each day that might go up and down. But if those symptoms persist or if they're getting in the way of your day-to-day life, making sure that you seek out support and talk with a doctor or therapist is really important. So anxiety. So, we've probably all felt fear about something at some time in our lives. And again, anxiety is really on a continuum. So we might be someone who doesn't worry that much about anything at all, or we might be somebody who worries a whole lot, and that fear can be really paralyzing. There can also be a number of physical manifestations of anxiety, which I always like to include, especially for folks living with chronic illness and rare disease, because some of those diagnoses also come with things like GI trouble and, some of these other physical manifestations. But really, anxiety is fear or worry over what's happening now or what's going to happen in the future or what's happened already. So anxiety can be very like past focused, present focused, or future focused. And if you struggle with anxiety, you might be able to say, oh, yeah, I'm an anticipator. Like I worry about things that are to come versus I'm worrying a lot about these things that have happened in the past that I can't control. But in regards to living with rare disease and rare disease caregiving, some of the types of worries that you might experience might be around medical procedures, new treatments, maybe worried about the fact that there aren't any treatment options and what's life going to look like. You might also experience, a lot of people experience financial worries. Living with any chronic illness or rare disease can be incredibly expensive. And so might be worries about how are we going to pay for this, or how are we going to pay for college for our other kiddo while we're also trying to provide medical care for, our loved one with rare disease. And again, social support as well. Socially, I think folks can have a lot of anxiety around, what will people think of me when I'm out in public? Maybe you have a rare disease that's very visual. For caregivers, it might be more worries about what will people think of my loved one, or what will people think of me as the caregiver or the loved one. And again, some additional worries at the bottom here, worrying about a loved one's condition worsening or not getting better, medication not working, or again, lack of medication options, costs of medical care. All of that can really be present, again, both for patients as well as caregivers. So I want to also talk a little bit about stress. So again, stress is something we all experience in our lives, and we're not exempt from that. But understanding how it manifests in our bodies, minds, emotions, and behaviors, as well as how it impacts others around us, can be really helpful. So again, here's some more. All of these stats are from the National Alliance for Caregiving, and I have a link at the very end. They did a long study about rare disease caregivers, which is fantastic. But 67% of rare caregivers say providing care is stressful. Absolutely. Of course, if you have additional things on your plate as a human being, it's going to create additional stress. That's just normal and natural. And it doesn't mean anyone who's caregiving is doing anything wrong or that they should feel shame or, uncomfortable about that. It's just factual that caregiving is a stressful, I want to use the word job. It's not a job, but caregiving is a stressful activity to do. And there's so much tied to it around, again, caring so much, and loving your loved one. And so it can just be really, really stressful and challenging. And then, in the same study, they talked about rare disease caregivers and how their emotional stress is about twice as high as general caregivers, which I thought was really interesting, but again, not surprising whatsoever. And stress, you might say, well, what is stress? It might feel like overwhelm or reaching your limit. You might notice yourself kind of shutting down. So really, it kind of varies. You might notice, again, I always like to use this picture when I'm talking about stress, because I think it captures kind of the full body and mind and brain experience of it. But you might notice some of these other things as well. And what I'll say also is some of these symptoms, if you want to call them that, of stress can also look a lot like depression, and sometimes can look like anxiety as well, or even grief. And so there's a lot of overlap you're probably seeing in some of this. And yes, absolutely. And I think that's why it's really important to talk with your doctor and maybe a therapist about what it exactly is that you're experiencing and how to go about getting support and help for that. Oh, sorry, didn't mean to jump ahead there. So additional challenges for rare disease loved ones, these are things that don't exactly fall in any of those categories we just talked about, but that I think are real concern for sure for caregivers. oftentimes, I think especially this is true in the rare disease community, loved ones are expected to become experts in their loved one's illness without a lot of access to evidence-based information. So, as we all know in the rare disease community, there's a lack of information, a lack of research, a lack of funding, a lack of treatment options. And so all that, aside, loved ones are still caring for their family members, our friends day to day, sometimes all day long, right? And really expected to do that successfully without a whole lot of information or tools about what that should look like. And then at the same time, when you go, you're juggling these multiple roles, you're a parent or a spouse, but you might also be an advocate, you might be the transportation person, you might be, a case manager, having to schedule all the medical appointments, making sure people get there. So really, I think those roles and all the hats that you wear as a caregiver can be really minimized, then when you go to the doctor and they might say, oh, well, we're the expert and this is what we know about the illness. And it's like, well, we've been living this day to day. And I think sometimes that's forgotten about and how much caregivers really are involved in the patient's life. So, and then one other thing I wanted to point out here is the decline of caregivers' physical health. So, again, same study that I referenced before, but 23% of caregivers report that caregiving has negatively impacted their own physical health. And I think that's especially true as folks get older. If you're an older adult caring for a loved one, you're maybe neglecting your own care. But I also think that can happen with if you're a parent caring for a kiddo with rare disease or otherwise. So again, a really important reminder to make sure that you're taking care of yourself. And we'll talk a little bit more about that in just a moment. But first, I wanted to talk a little bit about burnout as well as compassion fatigue. So, you've probably heard these words before. And again, some of the symptoms of caregiver burnout or signs of caregiver burnout look very similar to things like depression or grief. And so knowing again that this could be part of what's going on for you if you're starting to experience some of these signs. But really, burnout is not specific just to caregivers. I see this a lot in the healthcare profession as well, and in other professions where people are providing care of any kind to anyone. So really the most important thing to know, I think, is that this is possible. So if you start noticing, some of these signs of burnout, and then they just become more and more significant over time, figuring out how can you get some respite? How can you take a break? How can you get more help? And also being aware, what are the things that you feel like are causing or leading to those feelings of burnout? And again, it's not about doing anything wrong or that you should feel shame about or have bad feelings about. It's just acknowledging that being a caregiver is really challenging. And sometimes you just need to step away or you need to take care of yourself. And sometimes that's not possible, as we know with, caring for children and also caring for rare disease loved ones. So I wanted to kind of shift gears a little bit. You might be thinking, oh my goodness, this is a lot of hard stuff about being a caregiver, and that's absolutely true. And there's also a lot of positives about being a caregiver of a loved one. So a few stats here. So 94% of rare caregivers report feeling pride in understanding their loved one's illness. So I would imagine that all of you have become experts in caring for your loved one and your loved one's illness. Also, 85% report feeling closer to their loved one. It might not be that a relationship, however it is initially started, you might not have anticipated that you would be in a caregiving role or doing caregiving things, but as those roles shift or even reverse sometimes, it has the opportunity to bring people closer together. And then a smaller percentage, 56% of people feel a sense of purpose in their caregiver role. And again, these are all from the National Alliance for Caregiving. There are a lot of other great resources out there, but because this study was done in 2018 and pretty recently, I wanted to use this. But I want to talk also a little bit about self-care for the caregiver. So self-care is kind of this buzzword in our culture that gets a bad rap sometimes, I think. There are a number of people out there in the world that believe that self-care is selfish, and that's not at all true. The way I think of it is we all have to take care of ourselves before we're going to be able to take care of anybody else. If we have drained our reserves, our resources, we're not going to be able to support people in the ways that we would like. There's a common kind of analogy that we use in the mental health world about if you're on the plane, putting your own mask on first before you assist your loved one with their mask in the event of some kind of emergency. So being able to use that analogy to maybe help yourself understand that, okay, if I'm not breathing, I'm not going to be able to help somebody else breathe, right? And it's, that might sound extreme, but I think in a lot of ways, that's a really helpful way to look at it. But with self-care for the caregiver, I think being able to be aware of your feelings is probably one of the most important things I can impart on everyone. There are a lot of folks out there who I think believe, for whatever reasons, maybe historically or culturally, they've been taught it's not okay to feel or not okay to express emotions. I think the most important thing you can do is say, hey, I'm having a hard time and I need help with X, Y, and Z. And being able to do that allows you to then access a whole world of support that you might need. I listed things on here like exercise, healthy diet, practicing good sleep hygiene. I'm well aware that as a rare disease caregiver, it may not be possible to practice those things regularly due to your caregiving duties. You might be getting up in the middle of the night to assist a loved one, and that's going to obviously disrupt your sleep and your ability to have good sleep hygiene. So, being realistic with yourself. I always put at the end here, setting small attainable goals for yourself around self-care. You're not going to leave, the conference today and say, okay, I'm going to start checking all these things off the list. It's just not realistic. But if there's something here that speaks to you that you haven't been doing, figuring out, okay, how am I going to incorporate that into my day-to-day life? Another thing I like to point out is taking care of your own activities of daily living. So those who are caregivers know that, ADLs are kind of the bathing, dressing, brushing your teeth, brushing your hair, maybe making a meal for yourself, things like that we help our loved ones with when they're unable to do that for themselves. And so making sure that you're doing all those things for yourself too, for your own self-care, but also for your overall health is going to be really important. Okay, so in the interest of time, I won't read through any more of these, but I believe you all will have the slides or the recording, so you'll be able to look back later. Okay, so just for a couple minutes, I want to share about our organization, the Center for Chronic Illness. So CCI, we started in 2016, and we're based in Seattle, Washington. We're actually a remote organization, so we don't have a physical location. I'm very lucky and privileged to be able to work from home. We're also a small organization. I'm a solo staff person, so it doesn't really make sense for us to have a physical location at this point anyway. But we do serve patients from across the country, so, or I should say patients and loved ones. So over the course of the pandemic, our organization has actually doubled in size. So we've been kind of quickly growing here, which is wonderful because that was always our goal. And our hope is to continue developing more and more programs that serve the chronic illness and rare disease communities. But right now we offer over 20 free ongoing virtual support groups, and all of our programs are facilitated by licensed mental health professionals, as well as we tend to take on master's level social work students. Those of you who were at the Rare Fair in person yesterday might have met our social work intern, whose name is also Allison. So our mission at CCI is really to promote well-being and decrease isolation for those impacted by ongoing health challenges through support and education. It's really a simple goal. Again, as a small organization, we really try to focus on building programs that meet this mission. And so that's going to be kind of our continued journey. And we definitely know that there are other needs within the chronic illness and rare disease community, things like case management, financial assistance, transportation, all of these things. But my heart as a social worker always fell into the emotional support piece, which I think is really lacking both in the rare disease community and also in our bigger world. And so that's kind of where we've begun. And someday maybe we'll be able to offer some of those other kinds of services at CCI. But I wanted to share specifically about CCI because I wanted you to know about our support groups for loved ones. So you can see the flyers here. You might not be able to read what's on them, so I will share a little bit. The first flyer is our Supporting Loved Ones group. So really anybody caring for a loved one, it might be a spouse, it might be a parent, it could be a sibling, a neighbor, a friend, anybody that identifies as a loved one caring for someone else with chronic illness is welcome in that group. And then similarly but different, we also have a parenting chronic illness group. So this group has been going on for quite a while, since before the pandemic. And when the pandemic hit and we moved all of our programs online, we were able to open it up to parents living across the country. So at this point in time, it's really open to parents who have kids at any age. We haven't yet had the need to kind of divide it out and make multiple parenting groups based on, parents who have kids or parents who have teens. But, if that need arises, we may eventually kind of expand on that a little bit more. And then we have a few communities within the rare disease community that we provide support groups for the cystinosis, urea cycle disorders, and thyroid eye disease patients and loved ones. So we have patient groups for each of those diagnoses, but we also have these 3 supporting loved ones groups for those as well. Okay, so that's what I have for you today. So again, here's my contact information. You're welcome to email us anytime. If you go to our website, you can see a full list of all of our support group programs there. Again, all of our programs are free of cost. We also have a list on our website of the steps that you would go through to sign up for a virtual support group. But you're also welcome to email us if you have any problems. And also, feel free to follow us on social media. We love to have folks on social media as well. And then I did list a few different resources for you here. Again, the most important one would be that Rare Disease Caregiving in America study that the National Alliance for Caregiving did. It's extremely thorough. I was really impressed by what they had put together. So definitely check that out if you're interested in this topic and want to learn more.
So now I would like to introduce my sweet and charming colleague and friend, Sarah Tompkins, who will be moderating Policy 101 section. Sarah is just a rock star advocate. She was, again, I said this yesterday, but she was lobbying this year from the hospital, and I just can't get over that. I told her, are you sure? She kept telling me, hey, this is what my life is like for me, so I'm going to do it. And she has several rare diseases and has been through so much, and I don't know how she does it, but you would never know because she always has a smile on her face. So bless her heart. And yeah, but I was going to say, so she began her patient advocacy journey with helping establish a rare disease day in Washington State, actually. And Sarah, since in 2015, Sarah has advocated with Rare Disease Legislation Advocates, RDLA, during Rare Disease Week and Rare Across America lobbying for legislation and policy important to the rare disease community. Sarah serves as a board member for the Northwest Rare Disease Coalition and Eastside EDS 501c3 and has furthered her own Ehlers-Danlos syndrome and rare disease advocacy by competing in Ms. Wheelchair. I always feel like I'm saying this wrong. Miss Wheelchair Washington, USA, right? Did I say that one?
Yes, last year I was Miss Wheelchair Washington, USA, and for the Miss Wheelchair USA 2022, I was first runner-up, which was a huge win for me. Yes, thank you.
Thank you, Sarah, for filling that in for me. I was like, I'm going to get this wrong.
There's a lot of titles.
I will let you take it from here, Sarah. Thank you.
Well, thank you, Carolina. I'm so excited to be here and to be moderating this section on policy specifically because that is at the core of what Northwest Rare Disease Coalition is about. And we're really excited because we believe that the more informed and empowered advocate you can be is by being knowledgeable and truly, you can never stop learning in this particular rare disease community. And so I'm excited to present our first speaker, Kathy Delvaney, who is the Director of Advocacy and HCP Relations with PatientWorthy, who's going to present for us a little bit about rare disease stories for understanding. Thank you so much for speaking with us today, Kathy.
Thank you. So at PatientWorthy, we are a website with lots of social media that shares rare disease stories and news. And we have about 20,000 stories on our site, and about 50,000 readers every day. And so we think quite a bit about story sharing. And I've recently started reading a blog by Christopher Anselmo, who has limb-girdle muscular dystrophy. And he talks quite a bit, and I certainly recommend his blog to everyone. It's called Hello Adversity, is that he was seeking a story so he could find a path, someone to imitate, a role model to deal with a diagnosis that he got in his 30s that he wished he never had. And the advantage of stories comes is that it really does help people understand. And so this is the old Jewish proverb about truth, naked and cold, had been turned away from every door in the village. Her nakedness frightened people. Taking pity on her, parable clothes her in story. Then truth knocked again at villagers' doors and was readily welcomed into people's houses. And so we think about the oral tradition of sharing stories in the time even before writing, the fact that Jesus spoke in parables, and the incredible acceptance and ability to communicate through a story. And stories also, because they help people understand, it's not just the general public, but it also helps researchers. It helps legislatures. It helps everyone who's advocating for folks with rare disease, because a story can help people understand in a way that a statistic can't, or that a clinical medical record can't. So stories really do help us to communicate both with others in general, but also with those who might have power, influence, ability to take action that can help us live a better and fuller life. And this is my hand analogy. I used this in 2017. Carolina reminded me of it, so I had to go back and do it. These are just a few quick tips for when you want to share your rare disease story. You can think about it as your hand, that your thumb is your strongest digit. When you want to press down on something, to insert something or to give force, you use your thumb. And so your rare disease story can be very powerful, like your thumb is powerful, to make an impact on the community. Second is your pointer finger, and that's I. And so I would caution everyone to remember that this is a first-person story, and that your experience is not going to be the same as everybody else's. And so when you speak, if you are speaking not for everyone who has a diagnosis of adrenal leukodystrophy, you're speaking for yourself. So I think it's always best to keep our rare disease story in the first person. The middle finger is the finger that people use when they aren't being very civil. And there is no one who has not been done wrong to. But in a rare disease community, I can't think of a single patient who cannot remember a clinician, a health professional who dismissed them, who was condescending, who felt that they had a psychiatric rather than a physical problem, and who, quote, did them wrong. You know, that's part of the human experience, that we all face people and situations that are unfair. It's part of life. And so even though you're sharing your story and that misuse and abuse has happened to you, it's really best to keep your story civil. Your ring finger is for loyalty and fidelity. And it's also important in your story to share all those people who have been supportive, loyal, caring, loving through so many kinds of adversities that come with having a rare disease. And so as you share your story, don't forget that support that you've had there. And then the pinky finger, that's for the kids. It's for the little. So many rare diseases happen as children. And as parents, sharing our story and their story can be very cathartic. But we should also be protective of those kids. Remember, they will hopefully grow up to be adults one day. And the long documentation of everything they have been through can be a wonderful story, a wonderful testament, but think about what you as an individual might also like shared, and remember to keep some privacy, some protection over our young ones who have their rare disease. Another piece of storytelling is that we all read other people's stories, and it is amazing how many blogs, Facebook groups, online communities there are. And so if you have a particular rare disease, you can read many stories from other people. Sometimes this can be very difficult as well. The people who are online the most and sharing the most are often those who are having the most trouble. They are struggling the most. And so while being in a community of people who understands can be very supportive, you also have to be careful to not think that everything that happens to someone else is also going to happen to you, that everybody's struggle that you read online is foretelling your own future. Because one thing we know about life is that it's very individual, and that's true even for rare disease or common disease. I recently attended the American College of Medical Genetics, and even though BRCA1 is one of the best known and most highly penetrating genes for breast cancer, there are a couple versions of BRCA1 that almost never cause breast cancer. So you need to keep in mind that your situation is unique and that your story is your own. You also have to remember that there's so much to you, that your story is more than your rare disease, than your symptoms, and your genetics. So keep that in mind. And then in addition, keep a sense of humor. Humor is a serious thing. The evolutionary anthropologist Steve Dunn was diagnosed with stage 4 mesothelioma. And as he started reading about his new diagnosis, he said, "The swords of battle are many, and none are more effective than humor." And he went on to live 20 years after his stage 4 diagnosis. So it's important to keep in mind that a sense of humor is it's not nothing. It's an incredible sword. It's an incredible resource that we have for dealing with our stories and our rare disease. Also, as you write your rare disease story, it can bring about opportunities. And I bet everyone listening here has had some opportunities arise from the fact that they have a rare disease story. And it's good to keep an ongoing list of the positives. It's so easy to remember the negatives. Mark Twain used to say that he could live for a week on a good compliment, but most of us instead remember the insult, and that plays over and over in our mind instead of the good compliment. And the same thing happens with our opportunities. So if you are struggling with a rare disease, keep an ongoing list of the positives that has also brought to you. Secondly, keep in touch. Your network, your rare disease story is not a final story, it's an ongoing story. Your life is an ongoing story. And none of us make it without a network. We have people who help us with health insurance issues and people who help us with adapting to a progressive disease, and people who help us to find new connections. And so many people have 50 people in their network. Don't neglect it. Keep in touch with people. Touch base with those who can help support and nourish you. Then seek out opportunities. Apply for the grant. Take the extra course. Attend the conference. Pay attention to what the world may have to offer you, and be brave in doing that. The best, fullest life is a life that has a full failure file, inches tall, of things you've applied to and not gotten, things you've wanted to do and not been accepted, opportunities that you couldn't fulfill. But if you have a big full failure file, you're going to also have a great opportunity file. You will have also, there will be successes out there, but you have to take those initial steps and try. We don't know. We are just around the corner. There are all kinds of new things that might be happening, and it might be an opportunity for you to make a full and wonderful continuing story. And so as you share your rare disease story, you have a true opportunity to be a role model for somebody else. You have an opportunity to show them a path they may not have seen. You have an opportunity to help others. But don't make the story, don't give it a premature end. Remember that it's an ongoing story, and how you felt 5 years ago and where you were 5 years ago is not where you're going to be 5 years from now. So while I encourage everyone to share their stories, see it as an ongoing piece. And it is that continuing part of the story that gives so much hope to others.
Next, in our policy section, I would like to introduce the co-founder of Northwest Rare Disease Coalition, as well as the vice president of the Desmony Consulting Group, vice president of public affairs of the Desmony Consulting Group, and my good friend Max Brown, who is probably the policy extraordinaire of Northwest Rare, and I'm sure we'll learn a lot from him. Thank you so much, Max.
Well, thank you for that introduction, Sarah, and Catherine, for that shot of motivation this morning. Appreciate that as good framework for the policy process too, I think, and we'll get into that in a second. I did also want to invite here to the virtual stage my colleague Emma Scalzo. Emma is the Alliance Development Manager for the Desmond Consulting Group. You probably if you signed up on a listserv related to legislation with Northwest Rare Disease Coalition, you've probably gotten an email or two from Emma inviting you into the advocacy process in different ways, either through lobby days, committee hearings, testifying, or other kind of like sign and send type email opportunities. Emma is joining me here today. She really owns the engine of advocacy that powers a lot of the work that we did over the past session. And so I thought today, as yesterday, I should say, we dived kind of a lot into the topics of what we were working to achieve, and had some great panelists to speak on those things. I thought today, in this kind of policy and advocacy 101 session, we'd focus a little more on the tactics of getting bills introduced and kind of moving them through the process. And so Emma is going to be, a great resource to us, certainly in that conversation, but also moving forward as we start to think about how we approach the interim and then the 2024 session to be successful. So maybe Emma, could I have you introduce yourself, maybe just a couple minutes about, yourself, your background, and kind of what you bring to the table here?
Hi, everyone. I'm Emma. Yes, you've definitely gotten many emails from me, whether it be a newsletter or maybe an individual sign-on ask. I am always clogging up people's inboxes, but it was really good to meet most of you guys.
Fulfilling their inboxes with opportunities
Yeah.
to make a difference.
Good reframe. I appreciate that.
Yeah. Right.
So yeah, actually, I'm kind of new to this not new to the advocacy space, but new to like the medical and patient advocacy space. Before this, I was working for an affordable housing nonprofit that was focused on advocacy as well as member services. So kind of working with a very niche audience. And now I'm learning so much more about the healthcare space and healthcare sector and what potentials there are with patient advocacy sharing their voices. So, whether it be a lobby day or a petition ask or storytelling options, I've done it before, but seeing it in this space, really, I think I can see how much it moves lawmakers, stakeholders, everybody in the sector is really, really compelled by patient stories and advocacy. So, learning a lot, but I've really appreciated working with you guys over the past year and a half. So
thanks, Emma. Welcome. So I'll spend just 1 or 2 minutes talking about the 2 legislative priorities that we're working on the Northwest Rare Disease Coalition perspective this year, and then I'll give another couple minute overview of just kind of how a bill becomes law in Olympia, just to kind of give you a sense of the steps along the way and why when Emma reaches out to you with a sign and send form or with a petition or with an invitation to a committee hearing, kind of where that all fits into the kind of tactical reality of being successful in the legislature, and then hand it back over to Emma, really to talk about the different tools that we were using over the course of the campaign, just so folks have a sense of how we engage and where. And one thing I will say too. I know it feels like there's always a moment of urgency and action, and that's true, right? We're always sort of vying for time, with the legislature or in committee settings against, frankly, hundreds of other organizations who are also, trying to have their voices heard, trying to get their priorities move forward. And so, the kind of advocacy work that we do and the way that you partner with us in community at every step along the way, and I know it feels like a lot sometimes, helps the Northwest Rare priorities kind of get heard or get scheduled or, get time amidst a pretty busy and I'll just say competitive space, that where many folks are trying to get their work done too. So just know that it's all good, it's all important, and that the turn helps us succeed during the process. So in terms of the issue overview, we had 2 legislative items we were working on this past legislative session. One is House Bill 1079. So it was prime sponsored by Representative Milan Tai, co-sponsored by Representative Slatter, Representative Ryu. This bill would have required our state's healthcare authority, which manages the state's Medicaid program for low-income families, to create coverage guidelines for families to access rapid whole genome sequencing for children under the age of 1 who aren't able to be diagnosed by conventional means. So that was the first thing that we were working on, sort of an expansion of coverage for whole genome sequencing for children under the age of 1. Our second priority bill, Senate Bill 5097, was introduced, prime sponsored by Senator Jeff Holy in the Senate, as well as Senator Marco Lias, would have created what's called a Rare Disease Advisory Council in Washington State. This is similar to, there are similar structures that have been created in 26 other states across the country. This is a 12-person council that has the mandate and authority from the legislature to study and report back to legislators on issues confronting the rare disease community and proposed policy solutions that might help any identified gaps in healthcare access for the community. The bill would also create what's called an incidence and prevalence report for rare diseases in Washington state. This is functionally a count of rare patients. This is important because in the past, our state's healthcare authority has declined to implement proposed legislation that would have impacted the rare disease community because they said they could not or would not count the number of rare disease patients in Washington state. A lot of other diseases have ICD-10 code, sort of a straightforward way for our state to articulate the quantity or impact of proposed legislation. We don't even have that kind of baseline metric that we've seen in the past has been an obstacle for us passing legislation that helps the rare disease community. So that's thing one: create an incidence prevalence report. Thing two, Senate Bill 597 would also create a centralized website with resources for the rare disease community, patients, caregivers, kind of a one-stop shop. So once you get a diagnosis, you have a place that has vetted information to help get connected to clinical resources, find other community members who are traveling the same pathway, and other types of wraparound supports that families might need as they navigate the rare disease journey. The third thing it would do would be to create a continuing medical education program for clinicians in Washington state. This is to make sure that doctors, nurses, other folks who are helping rare disease patients have more resources to be able to better identify and get patients into the right treatment pathways moving forward. So that's just a fast overview of kind of what we're working on this year. Now I'm going to talk through a little bit about kind of what is the pathway for a bill to become law, and kind of what are the steps that we had to move through along the way with each of these legislative items. I'll note, I think something like 85 or 90% of bills do not make it all the way through the process. So each one of these steps, there are I don't know, a number of sort of points at which you can face an obstacle and sort of have to reorient your strategy or do something a little different to try to move to the next step. So okay, so let's get into the 101 here. So the first thing that you got to do when you're trying to pass a bill is to find a legislative champion for that bill, and ideally somebody who is also seated on the policy committee of jurisdiction. So the legislature sort of, as they do all this work, they start with an array of different committees that focus on different issues. For us, finding a champion who is seated on the healthcare committee was really important. So with Senate Bill 5097, Senators Leas and Holy were ideally situated to help us on that pathway. For 1079, Slatter and Ty were both kind of ideally positioned to help us get introduced in committee, which is the first step. Actually, you can go all the way through, find a legislative champion, work with their committee staff to actually write the bill language, get the bill kind of introduced, and then if you don't get committee time, you're kind of stuck. So that's kind of the first step you need to take, is to get scheduled for a public hearing in your committee of jurisdiction. You then need to be scheduled in that same committee for what's called executive session, which is where the committee, after hearing your bill, decides whether or not they're going to vote on it. And of course, then you need a majority of the votes out of the committee to be moved on to the next step. With most bills, that next step then is to go to what's called a fiscal committee. So every 2 years, by dint of the state's constitution, legislators have to create a balanced budget. So any bill that has an impact on the sort of fiscal reality of the state of Washington, or impacts the budget, requires the state to spend money, needs to be adjudicated by a fiscal committee. So they decide and hear, how much is the bill going to cost, and then decide whether or not they're committed to that expenditure. After you get through the fiscal committee, you then go to what's called the Rules Committee. And the Rules Committee is, you can think of it as like the scheduling committee for the body as a whole. You have to be then pulled out of the Rules Committee by a legislator to be scheduled for floor action. That's when the whole body, either Senate or House, takes a vote in the affirmative for your bill. Assuming you pass that step, the bill then moves over to the opposite house. So If you're in the Senate, you start in the Senate, then you go to the House of Representatives. If you start in the House of Representatives, you go back to the Senate, and then you have to work the whole process all the way through again, assuming you make it through both chambers, and they pass legislation that is the same. Then your bill goes to be signed into law by the governor of the state of Washington. So at every step along that pathway, you can fail to get scheduled or heard, or there's all kinds of things kind of underneath the process that can happen that can inhibit a bill moving forward. But the way we make the case to legislators that they need to prioritize the legislation that we're working on is by engaging in advocacy activities, and those have a couple of different kind of tactical outputs. And so, Emma, I will turn it over to you. Oh, sorry. One last thing I'll mention. As you're moving through the legislative session, there are timelines kind of built into the session. So you have to move through each step before a certain number of weeks has passed in order to advance in the whole process. So you're also sort of working against a clock that's ticking, to make it past that policy committee, to make it past the fiscal committee, to get a vote on the floor, which itself can be a barrier to success. So sorry about that. Emma, over to you. Let's hear a little bit more about kind of the tactical tools that we use to succeed throughout the process.
Alrighty. Hey, thank you. I have some links that I'll be dropping in the chat just for like visual aid, but so feel free to click on them, but also I'll kind of walk you through what each of these tools is. So thinking about like engagement and advocacy in terms of like a ladder of engagement, you want to make it easy for folks that, want to engage. So kind of like the first ring of entry, I would say, is getting your list together. So this is a form that we circulated. We hosted a community briefing for our community members to kind of help inform our advocacy process. And we shared this form that said, hey, I'd like to sign up for advocacy updates. So that means we have a narrow audience that we're recommending folks to engage on certain efforts. So we're not bombarding folks that, were interested in the fair or might be in a certain community support group. Like we specifically have this list for our advocates. And I think that's really good. So you're not bombarding the same folks with, advocacy asks. And we want to keep our community like informed and engaged. So it's also just at the very least, if people are interested, they can just sign up for updates and they might not need to engage. I would also recommend if you haven't already filled out that form, you should do so. So then we can keep you up to date for next legislative session. But this is really important because this kind of informs our newsletter list, and you'll kind of see what opportunities we send out after that. So this is another form that we kind of had later on. This is kind of like the second round of kind of getting folks into the advocacy process. This is a petition form, and this is just a general support form for our specific bills. So after folks were kind of briefed on what kind of to expect for the legislative session, we got our bill numbers, we got our bill language, so we knew exactly what we were advocating on, and we could then present it to folks. Folks can sign on, and then we have this list of, organizations, advocates, patient information, and we can bring it to legislators and say, look, this is 35 folks that, or like 20 folks in your district, or things like that we can do, that we can use to compel. Oh no, the links aren't going through. Oh, well, I'll share them after this. But basically that we can then present to specific legislators, and we can really help inform them of the advocates in our districts that are most interested or most directly impacted by their leadership. So making sure that they know that we're watching these bills and we're supportive of these bills, and having that specific bill language is really important. So by having folks sign up earlier, then we knew we could loop them into this petition opportunity. Lastly, we have a sign and send form. And these ones, I bet folks are probably a little bit more familiar with, because I feel like we tend to engage most with these. They're a really awesome, like I'm a total nerd for this program that I'm talking about, but it's a really awesome way to engage. So basically what it is you can input your information, and like you have your email and maybe your organizational affiliation and then your zip code. And using your zip code, you can get connected directly to your legislators, whether it's your local legislator. You can use this on a federal level as well. And we can draft up a template message that, some folks can just sign and send it away that says, I support these specific bills, but then also you can customize it. So, even if you're just changing a few sentences at the beginning, talking about your experience and sharing your story, it really does mean a lot. And we get a lot of feedback from legislators about how interesting these engagement opportunities are, because they're connecting directly with their constituents. We try to make it as easy as possible. The bill language is already there. So really all you have to do is add what this legislation means to you and what you'd like your lawmaker to do about that. So I think that these are really great tools to kind of keep folks engaged and kind of keep them in the legislative process without making folks go to Olympia or to testify, which is a really high pressure situation. You can be weighing in throughout session and you could never join a committee hearing. And I think that's really exciting. And you can actually have a really big impact by personalizing your messages, staying up to date, but then, just weighing in when you can and trying to make it as easy as possible for folks to do so is kind of what really excites me about the work we're doing. So yeah, thank you.
Great. Thanks, Emma, for that. And I saw a really good question in the chat here. I wanted to respond to Michelle asked, if the bill does not get through the process in the current session, do you have to start over from the beginning of the next session? So that's a really interesting question and an important process question too. So Washington State has a part-time legislature. What this means is that they sort of split their work over 2-year cycles, kind of. So every odd year, we have what's called the long 105-day session. That's kind of the beginning of they call it a biennium, a 2-year cycle that you can kind of think of as one extended session from sort of a process perspective. So to answer your question, all the work that we did this year advocating for the bills, we can pick up basically where we left off January of next year, which raises another interesting point, which is to say we have this gap, right, obviously between session adjourning a couple weeks ago in January of this coming year. We can engage legislators in their own districts, right, and have the time and opportunity to kind of explain to them the priorities and why they're important for the coming session. So that's going to be a really critical. It's critical that we use this, what's called the interim time, to have these conversations that we're set up for success again come January in this form that Emma shared. If you haven't already signed up for the Every Action form, I'd encourage you to quickly do so, because that will just get you kind of in the lane of hearing from us on our advocacy priorities and the opportunity to weigh in as the time comes. So we have just a couple more minutes here for our session. Let me just see any other questions that we had in the. Okay, Carolina, yes. Talk about the briefings and why are they important. Yeah, so Emma mentioned that we held a legislative briefing in advance of this past session. We brought together, invited every legislator or a member of their staff from the committees that we knew we were going to be kind of walking through in the process to join us for a virtual briefing to hear from patients across the state and clinicians and other folks who are working with the rare community about the priorities we're proposing. I think it's from a process perspective, whenever you introduce a bill, you're always working to try and find original co-sponsors for that bill. So having this kind of briefing in advance of session helps us educate lawmakers and their staff about the legislation, and hopefully gets us some folks who are going to be signing on as co-sponsors to the bill. Obviously, the more co-sponsors you have on a bill, the more breadth of support you're sort of demonstrating at the outset. That's an important function. And then too, just kind of gives folks a heads up about what's going on. I think even as we did the in-person lobby day this year, our advocates who were able to attend. We're still doing a lot of education with lawmakers and their staff about just like, 101, what is a rare disease? What are the gaps that patients face every day? Why would the legislation be helpful? So, the more we can provide that kind of educational content on a consistent basis, the better off we generally fare in the session. And, it's fair to say some of the staff positions in Olympia can turn over, fairly often. So, year over year, you might be working with a different legislative aide or committee staff person. So we just never assume that folks kind of have perfect information to act on the legislation. We're always trying to provide these opportunities. Okay, let's see. Other question from Helena. Considered expanding the bill for genome sequencing to individuals over age 1? Yes, great question. When we first introduced House Bill 1079, the age bracket that we used was 21 and under. We wanted to go in with as broad of a scope of applicability for the legislation as we could. As we work through the process, though, and working with the healthcare committee chairs, one thing that they kind of do when they gauge whether or not they will be moving forward with legislation is they look across the country and kind of see, what are other states doing in this space. The consensus, at least at this moment, I think the 6 or so other states that have provided Medicaid coverage for rapid whole genome sequencing have started in this under the age of 1 bracket. So we're, wanting to make sure that we were going to be able to be successful in the process and move the bill as far as possible. The kind of communication we're getting from our healthcare policy committee chairs, who would be determining whether or not we would move or be scheduled for hearing at all, was this is where states are at right now. This is the first step we want to take. And they wanted to, integrate input from the state's healthcare authority, from children's hospitals in Washington, to be a part of that process that articulated the guidelines for that coverage. So I see this as the under 1 age bracket is like a, good kind of beachhead, right, for us to start. If we can get HCA, the healthcare authority, to, move forward with this, and legislators to move forward with this, the sort of set of rules that they'll articulate around coverage for rapid whole genome sequencing, we could then take that set of rules and come back later with, either commercial plan parity for that same set of rules or expansions of the age range, as inevitably the, those same expansions might occur in other states, or more studies have been done, or there's other data available that we can use to make the case to expand the age range. So it's sort of a first step we see in being successful in that larger project. Thank you for that good question. Okay, am I missing any? Sorry, my chat, I feel like, is not. All right. Did I miss anybody's question here? Or does anybody else have anything else they'd want to?
I'm not seeing any questions in the
Okay.
chat, but
Okay.
please, anyone, feel free to ask any Q&As in the chat or otherwise. But thank you so much, Emma, Max, and Kathy, for speaking. It's so important to be as well informed as possible, especially with, as you said, state legislation is so specific to each state. And it's so important for us to all learn these Washington legislative little special rules and processes and how to engage to be the most effective advocates we can. And I'm really so grateful because you all empower us to really do that here.
Happy to help and to be your partners on this journey. I know it can feel incremental at times, but I promise every engagement counts, and lawmakers really do listen as folks are representing interests and needs from their district. So thanks to everyone who engaged or will be engaging with us in the future.
We have a question from Harlena. What about children who come from other countries and need treatment here in the U.S.?
Yeah, insofar as our state's Medicaid program is providing care and coverage for those populations, they would be included as part of this bill. I believe there has been legislation previously that permitted our Medicaid program to cover undocumented families and other folks who might traditionally fall outside the usual kind of coverage spectrum. But let me check on that and get back to you.
Now I'm honored to introduce my colleague and friend, Lindsay Topping-Schutz, and who is an amazing advocate and mama to Sweet Owen. Just love her. I just was thinking about what Kathy said about humor, and that's bringing humor to the stories and the importance of that. And I think Lindsay does a wonderful job of that, and it's just super authentic. So, and it just shows. Lindsay's a member of the board of directors of the Northwest Rare Disease Coalition. She also does advocacy work for the Northwest Pediatric Palliative Care Coalition, Pierce County Interagency Coordinating Council for Early Support for Infants and Toddlers, Washington State Parent Institute of Engagement, and Mary Bridge Children's Hospital. She's involved in a lot of stuff, as you can see. She's a power mama. She remains dedicated to educating people about the rare disease community by sharing her family's story. Thank you, Lindsay. I'll let you take it from here.
We are just getting started here with our last section of this year's Fair and Summit. So our first speaker, Ryan Sheedy, is going to be speaking to us about putting me back in medicine. Ryan, you are a busy man. I follow you online, and Ryan is a rare disease dad. He is a caregiver, and he has created this amazing app that is revolutionizing the way that we as patients and caregivers can help to keep track of our lives and all of the medical details. So Ryan, thank you so much for being here. I'm going to hand it over to you.
I'm really excited to be here today to walk you through a little bit about our rare journey, and as Lindsay mentioned, a tool called Mijo that we created because of a need that we saw from our son and all of the other rare disease parents, caregivers, and families out there. Our goal is to really humanize our kiddos with rare diseases and medical complexities to be more than just who they are from a diagnosis standpoint. And so we're really excited today to walk you through a little bit about our journey and about the Mijo platform. So when I think about rare disease and kiddos with medical complexities, I refer back to a movie that I watched even before having kids. And it was always very important and instrumental in a lot of the things that we're working on, that it really hones in on that putting me back in medicine. And the quote is, when you treat a disease, you win, you lose. You treat a person, I guarantee you, you will win no matter what the outcome. And that was from the movie Patch Adams. And that really has hit home for me, even before having a kid with a rare disease, and even more so now meeting kids, parents, and folks in this space. So hi, we're the Sheedys. This is my wife, Ashley, and our three boys, Mac, who is a little bit over 2 years old, and our twins, Campbell and Reynolds. And Reynolds is our little guy that has Costello syndrome. We've lived in Northwest Arkansas for over 10 years. I became a stay-at-home dad almost 5 years ago, and my wife leads the marketing team at Sam's Club, where we're headquartered. So when I think about how our rare disease journey started, I often joke 5 years ago, I didn't even know what a rare disease was. Come to find out, my mom, who has multiple sclerosis, is a rare disease patient. So before kids, had no idea about rare disease, and then having our twins got thrown in pretty quickly. So in 2017, my wife Ashley gave birth to our twins, and that's when our rare disease journey started. We just didn't know it. We had no idea that there were going to be complications. All we knew was baby A was a little bit bigger than baby B. We had to be a little bit careful. Ashley would give birth. 2 days later, we'd go home. That wasn't the case. So we often hear, you plan, he decides, and that's kind of how we've been kind of thrown in here. And perspective has been something that I think about a lot as we go through this journey. Ultimately, we spent 103 days in the NICU with Reynolds trying to figure out what the root cause was, as well as getting him ready for surgeries that he needed to have to go home. So on day 103, we left with a G-tube and still had no answers. We spent the next few months meeting with doctors, still having more surgeries, trying to figure out what that root cause was. And we had so many questions unanswered. During this time, coming from the business world, I thought, wow, there's got to be a way to better organize all this information. I mean, we do it with Salesforce and Facebook and all these other technologies, but we don't have something specifically for the caregiver. And so I kept just chipping away of why. In May of 2019, we finally got our diagnosis for Reynolds, and he had Costello syndrome. And we got that diagnosis from a whole exome study. And as you can imagine, like I've talked to so many other parents who get that phone call, there are so many questions to this new life that you were told about. How do we care for our child the best that we can? Most of us don't have healthcare backgrounds, so we don't know how to navigate. We just know we need to do the best for our children. And then we're ultimately given that new title as advocate. And we're just doing the best that we try to do every day. So this is Reynolds. He has an ultra rare disease called Costello syndrome. Costello syndrome is a genetic mutation in the HRAS gene. About 1,000 kids in the world have it. It affects multiple systems within the body. Reynolds is predisposed to childhood cancer, so we get him screened every 3 months. He's had countless surgeries, and on paper, he's considered to be extremely medically complex. He has a very large team, and he's had so many surgeries, and I can spat out how many doctors he's seen, how many surgeries he's seen. But this visual here is a really good representation of, on paper, this is what our kids look like. They're very complex. So as other parents and caregivers of rare disease patients, we fill out so many forms to get qualified for programs. And so we had to fill out a form to get Reynolds qualified for a program. And after we submitted our paperwork, the caseworker asked me if I wanted Reynolds' medical records. And I said, sure, send them in the mail. And she said, Ryan, I can't. She said, there are thousands of pages here for Reynolds. And I said, okay, I want those. So I met her in an IHOP parking lot, and she gave me box after box after box. He's 5 now, and so this was how many pages he had at age 3. And I thought this would be an amazing visual for people to kind of see. And I have another picture where he's standing beside it, and it's taller than he is. So I can only imagine what it would look like 2 years later. But that's Reynolds in the EMR. That's Reynolds at the hospital. This is Reynolds as a kid. So here's what's not in his chart. As I mentioned, he has a twin brother, Campbell, and he has a baby brother. And the 3 of them, they make the circus every night here at our house. Reynolds loves Blippi. He loves Blippi's new friend, Mika. He does equine therapy. His therapy's horse name is Newt. Reynolds has 5 words that he speaks verbally, and purple is one of those. And so I'm excited to go to our derby party today wearing a purple bow tie to really pay homage to his love for purple. He walked for the first time at 3 years old. So that was a huge milestone for him. And I'll never forget it. He walked into school on his own by himself. And that was one of the best days of my life. He's now started to eat by mouth. He uses an AAC device to communicate. And I think it goes to say about a lot of our rare disease kids, how personal they are, how affectionate they are. They call Reynolds the mayor at school. He loves to give high fives to everybody. He loves to give hugs. And he's known around town as Reynolds. Every day I talk to somebody like, oh my gosh, you're Reynolds' dad. And that just means so much to me. Since having all of these complexities, I've talked to so many different rare disease caregivers and parents and identified a problem. If parents and caregivers are crucial to their loved ones' well-being, why are they burdened by a lack of time, funds, and assistance? We know being a caregiver and parent to a rare disease kid, it's time-consuming, we're underserved, and it can be very expensive. And there's challenges at every turn. And the challenges that we're looking at today is just the administration tasks of being a rare disease caregiver. Caregiver administration burden is a real thing. And I want to tackle it, and I want to conquer it, and I want to put more time back in people's lives, because maintaining this information is tedious. Explaining these specifics and details is emotional. I sometimes feel scared that I'm going to forget a piece of information when asked in a timely manner. Capturing all this information is daunting. Preparing is stressful. Repeating. I know you guys all can relate how many times we have to repeat what medications, what diagnosis, what dates, and so forth. And also organizing all of this in a fashion that can be usable. Never in my entire life have I ever been called organized. But I had to be because there were so many details that I didn't want people to not know about Reynolds from his medical diagnosis. So here's a little picture of my counter. I'm sure a lot of you guys can relate. Medications and spreadsheets and binders and all these different things, and information scattered all different places. And there's so much to remember. And yet I'm asked to tell the same story over and over and over again. So just like a lot of you, we find a way. And so I created a little PowerPoint for Reynolds. At this point, I think I was calling it This Is Me. And I used to pass it out to different doctors and therapists and babysitters and people that would care for Reynolds because they had so many questions. And I would just say, here you go. And it was just the Cliff Note version of Reynolds. And we were at our first Costello conference a few years ago. And a doctor asked me if I could give her that sheet because she said it was best in class caregiving. And she wanted to show this in one of her talks. And I was flattered. And I was flattered every single time a doctor asked, how do we get this in the hands of all of our families? But then I thought, wow, there's a huge opportunity here. If what I created in PowerPoint using tables could be best in class and could really help people, there's an opportunity here. So just like I said almost 5 years ago, how hard could it be to be a stay-at-home dad? I said, how hard could it be to create a healthcare app with no healthcare background? They're both very hard jobs, and I'm sure a lot of you guys can relate, but it was needed. And they always say that necessity is the mother of invention. I like to say it's the father of invention because I'm a stay-at-home dad, and this is where we are. But then enters Brett. Brett is like my manna from heaven. Brett became my co-founder. He spent 20 plus years at Cerner as an executive at one of the largest EMR companies. He also is a rare disease dad. And so he and I came together to create this tool, to create this platform, to create this community that we're hoping will really help and revolutionize this area. So we thought, what if you could always have your kids' medical and care information a click away when you're asked for these details? What if you could download this information in a shareable PDF that you could send to school, therapy, and Medicaid, or camp? Remind me to tell you that story in a couple slides. What if you had a way to securely share this via email or text to a babysitter or grandma instead of having to write those details down all the time? Well, we created it. It's called Mijo. It's a digital caregiver companion. And in June of 2022, we launched this free web app that provides parents and caregivers with a better way to simplify, organize, and share their child's most important medical and care information. And I'm so excited to say, since June, we've had over 1,000 families across the US use the platform. I'm inspired every single day because I hear from moms, some dads, come on dads, how they're using the platform or how they found out about it. And that really, to me, is worth every dollar, every hour, every just thing that we've put into this. And I'm so excited to kind of give you guys a little demo for those that haven't seen or heard about it today. But before I say that, we built Mijo on 5 principles. And Brett, coming from the EMR world, he made me promise him before he came on board that we wouldn't make this complex and comprehensive, but simple. And so the 5 principles are, is it useful? Is it simple? Is it caring? Is it human? Is it empowering? So I'd love to give you a quick demo. Oops. Can you all see? Are you guys seeing the PowerPoint still, or are you seeing the app?
It looks good.
Perfect. So here's the app. It's simple. It can take you 60 to 90 seconds to sign up. We don't ask you a ton of information because this is for the caregiver. So the way we built it was to have everything displayed in one swipe or one click. And so we start off with a section called Getting to Know Me. And again, this is the piece where we talk about putting me back in medicine. Getting to Know Me section is the way a parent can communicate things about their child that are typically not in their EMR, or typically what a doctor, nurse, therapist, school nurse, or teacher would know about the child. We have a little icon section where you can pick different icons to really make it friendly. We have a section to put all your medications. The key also there is to put information about that medication and how it's administered. So we all have these kids that like, hey, give my kid a Skittle or play a song or root them on when they're doing it. And if the nurse, doctor, grandma doesn't know that, they're not going to take the medicine. So that is super critical. We have a section called My Procedures. We really wanted to make it really friendly, and that's why we said my in every section. We have a section here for conditions where you could link to different documents that you always have to use. You can call from the app. You can email from the app. We know that we often say it takes a village. We call it a team. So at any given time, Reynolds has 50 people on his roster that I am corresponding with, whether it be a case manager, a doctor, a nurse, a school, a babysitter. I have all of that right at my fingertips. The really cool thing too is I can edit the information directly from the app. And we created it a web app, not a native app, because we could add more features and functions quicker. But the cool thing is you can save that website to your phone, and so that it acts like an app, and you can have one click to all of this. So really easy, one swipe, everything is information right there. You can go to different sections. One of the things that I often use it for is my medical devices. Who can remember the size of the G-tube or when you last replaced it? And we've often been in situations where the doctor said, hey, what's that size again? And you couldn't remember it. Or the size of a pen needle when you're giving growth hormone. So we've really thought about all of these different places that a caregiver would really need, and give the user the freedom to enter this information however they want. You can also do a quick view. So let's say you're in the doctor's office and you're holding your kid and the doctor's asking you what dates and things like that. You can easily access this, all one view and one click. And it's all right there. So it's populating. You can download two different views. One is the journal, which is all of the sections that you fill out. The playbook is something that you would download to give to a babysitter or to a school nurse that doesn't have all the information. And then my favorite part is the sharing. How many times are we asked, hey, can you send this information to the babysitter? Can you send it to grandma? I often hear, sorry dads, I often hear from moms, I can send it to my husband or my spouse when they're taking the kid to the doctor, who typically doesn't go to the doctor's office. They have all that information right there. And you can send it via text or email. And you can also make it active for a certain amount of time. So it sends a secure link. So if you only want to give the babysitter access to it for 12 hours, that link will expire after 12 hours. Or you can give always access to a spouse. Real quick, you can add another kiddo. So it's super friendly for those that have multiple kids too. Carolina, thank you for bringing that up. We often tell parents to take this document on vacation for the unforeseeable emergency room visit where they don't know your child. And it's a really quick way to showcase the information about your kids. So that's Mijo today. We've heard from countless users that they get back more time. Mijo helps them gain peace of mind. It maximizes their time with physicians and providers. They feel better about caregiving. And I love this quote from Tuesday Dreyer, who is a PAG president. When you can share information in Mijo with the community that surrounds you, it helps everyone be on the same page. And that is crucial when you have a rare disease kid, for people to be on the same page. Since June, we've been doing testimonial Tuesdays on our Instagram, and we love being adored by our users. And they've been telling us amazing things, how they're using it in their everyday lives. Some of the quotes: raising a medical complex rare disease kid is challenging enough. Keeping track of the history shouldn't be. That's where Mijo truly shines. My last Medicaid call was 15 minutes instead of 45 because I sent Mijo. Like, that's a real time save. Mijo helps me not only organize medical information, but it gives me peace of mind. And Mijo helps me keep it all together as I advocate for him. Like, those are testimonials from users that I dreamed about that they would find in this platform that we built. Since June, we've been supported by patient advocacy groups who have been sharing it with their organizations. We've been doing Zooms where we get 20 or 30 from their community to come in, and we do a Zoom call just like this, and it's been really exciting. We even have some exciting news coming up in a couple weeks where we started with one organization on a Zoom call, and we're building a customized platform for their community. We're also loved by providers. They're the ones that are seeing this. They're the ones that really benefit from it. So if the physician only had access to the EMR, they wouldn't know that Reynolds loves high fives, that he loves the color purple, that they could build a connection with him or these other folks that they wouldn't have been able to do if they only read their chart. And it gives them a really quick way to see the full picture of what's going on, from ENT to cardiology to a dietitian, to all of those things. So it's super important for them to kind of see the full story. We've got some new features and functions coming up in a couple of months that I'm really excited to share. We're building what we're calling an easy tracker, so a way to track medications and seizures. You'll be able to build a customizable tracker for things that might be specific to your rare disease or your child. And then we heard from a lot of you that you wish you had a way to share and save documents, like an IEP document or a seizure plan. And so we're really excited about those new features. As I alluded to earlier, based off of one of those early Zoom calls, we're building our first patient advocacy group branded caregiver platform powered by Mijo that'll be specific to that rare disease org. And so we'll be announcing that in a couple weeks. We're already in conversations with a few others that want to do the same thing. And that just really makes us feel awesome and excited to do that, because we hear a lot of times, man, I really wanted to build my own app for my organization, but I don't have the funds, or I don't have the resources, or I don't know how to do it. Well, we're here for you guys, and we want to work with all of you out there to offer that. Real quick, I know I'm almost out of time. When we think about how Mijo can really play in with a rare disease, we call it moments of care. So the EMR really is great for what happens at the hospital, but think about how much care takes outside of the hospital, whether it's grandparents and babysitters, contacting providers, having diet information, intake forms, annual evals. I often say, see attached, because when they ask for my son's medications and they give me 2 lines and he takes 15, I usually having to write it on the back of the form anyway. Now I can do that very quickly. I've taken it to IEP meetings. I've heard numerous users taking it to IEP meetings. And so there are so many different use cases for it. This story really hit me hard. I've gotten to know Laura and Salim. Laura randomly found us through my really good friend, Effie Parks. If you don't know Effie, go look her up, Once Upon a Gene podcast. Laura started using our platform because her son Salim takes a ton of medications. She didn't have a way to organize it. And so she started using it, and she actually said, hey, I wish you could organize this in alphabetical order. We said, oh my gosh, we didn't think about that, Laura. Great idea. And so we went to work, and we now offer alphabetized ordering for our medications. But a month later, Laura reached back out to me and said, Salim got to go to summer camp without a nurse today. This was his first time going to an all-day camp solo. I made an emergency bag. God forbid they must call 911 or something, and no one was there to provide history. Mijo was so easy to print. I popped it in there, no worrying about trying to gather information from all different places. Yes, this is why I created this. She then texted me the next day and said, guess what? I forgot the bag at home and I live too far away. But sharing capabilities saved the day because I was able to send a text link to the camp counselor, and my mind is back at ease. That's the power of Mijo. That's why we created it, and that's why we're so excited for people to be using it across the country. So thank you so much for having me. I want to talk about how we can bring more joy to families, take some of that caregiver administration burden off their plate. So there's two ways to use Mijo. Families use it for free. It'll always be free. Use it, promote it, tell your community about it, tell your friends, and tell us what's missing and how we can do a better job. And then patient advocacy groups and industry. Let's work together to create caregiving solutions and capabilities tailored to your community. So if we all could just give each other a high five from Reynolds, the world will be a lot better place. Thank you.
I remember having a moment when I was about to cross the street from our health center, across the street from the hospital, as Owen was about to go inpatient. And I had this panicked moment of, if I get hit by a car right now, who is going to be the person that remembers all of the things? And I mean, you're finding the solutions for that. So that's pretty incredible. And I think on behalf of all of us, thank you for this work that you continue to do.
A lot of my different providers are at different hospitals or care centers, and just getting them to coordinate care takes me taking that extra call. Is this app able to have you note different providers, even if they're at different care centers? And does that help with any of the collaboration of that care process?
So today, what we tell parents and caregivers is to send the PDF ahead of time to different providers that might not know your child or their diagnosis or their situation. It does not link up to other systems. We feel like there's bigger things to work on and solve outside of the medical arena. But we really feel like Mijo helps people kind of see that full picture from the parent's perspective too. I think that's a huge piece to all of that, is there are pieces of quality of life information that are crucial to providers that they wouldn't see if they didn't actually talk to that provider. So specifically, how does this rash happen? Where does it go? What happens when this happens? And we really feel like that's super important for providers to know.
That sounds great, especially since it seems like you can take the app to these appointments and still use it as that invaluable resource that it is.
Yeah, my son unfortunately had pneumonia when he was hospitalized in the fall. And in a 12-hour span, we saw 10 different people who asked the same information, who have access to the same portals. What medications, what is Costello, are there any things we need to know? And I literally either handed them the phone, gave them the PDF, emailed the information, and they all were like, where did you get this? And I turned around my backwards hat and I said, I created it, and here you go. And so it was unfortunate that we had to build it, that something didn't exist, but I'm so glad that we're doing it now and so many people are using it, and we're really excited. I do have to tell one quick story. The picture of Brett and I, where I have in the slide, Carolina took that picture. That's how we met, Carolina, at the bottom of an escalator at Nord. So you never know what happens when you say hello to somebody. And I'm so glad we got to meet during that time. My email is on our website. Please contact us. And we're very eager and excited to hear from everybody.
We've got another speaker who we have heard from a couple of times over the last 2 days, Sarah Tompkins. And Sarah, have heard quite a bit about you and the different introductions. And one thing I want to make sure that people really know and understand is that Sarah is the ultimate person that balances grace and a fierce fire. You do it with such ease. And I don't know that I've ever watched someone so calmly and so eloquently put a legislator in check as I have witnessed you do. So I am a huge fan of you, and I appreciate all of the time that you give back to all of us, and you do it with a smile through incredible pain and challenges, and you're a real way shower for each and every one of us. So Sarah is going to be sharing with us today self-care for your healthcare. Thank you.
Thank you, Lindsay. Oh, I'm getting teary. That is definitely hits home. Thank you for that wonderful introduction. My presentation today is inspired by what was my platform for Miss Wheelchair Washington, USA 2022, which was Practice Self-Care for Your Healthcare. Again, my name is Sarah Tompkins. I live in Bellevue, Washington with my husband and Jack Russell Wilson. We have the privilege of living with my mom on a one-floor Rambler. So the accessibility and incredible privilege that I have through that support has been invaluable in enabling me to be the advocate that I want to be for myself and for others. I'm a member of the Northwest Rare Disease Coalition and Eastside EDS nonprofit and support groups board member. I'm an Ehlers-Danlos syndrome and rare diseases patient and advocate. I have no disclosures to make at this time, but I wanted to share again that I was Miss Wheelchair Washington, USA 2022 and Miss Wheelchair USA 2022 first runner-up. Let's see if I can, perfect. So to talk a little bit about kind of why self-care and practicing self-care is so important. As we know with self-care, self-care means something different for everybody. But as patients or a loved one or caregiver living with rare disease, self-care is absolutely essential because it really is a part of what is your medical care. It's just as important to seeing a specialist or seeing a geneticist or really any of the other kind of medical priorities that we have to make a forefront in our rare disease lives. As a full-time patient with the genetic connective tissue disease, Ehlers-Danlos syndrome, my self-care toolbox includes not only being my own best advocate, but others' best advocate as well as learning to be my own best caregiver. Actually, Karen and Allison did such an incredible job speaking to self-care. And when they said putting on your oxygen mask before assisting others, that is such a wonderful definition of really self-care. But what do you do if you can't put on your own oxygen mask? What does that self-care look like? Does it mean making sure that the person with you is helping or making sure that you know who can help you? So it's certainly different being a patient or a rare disease advocate or living with chronic illnesses where your toolbox is going to look different than others. In these pictures to the right, you'll see a picture of me in Washington, D.C. with the rare disease legislative advocates during Rare Disease Week in the pink suit, speaking with Representative Pamela Jayapal about policies and legislation that's important to our rare disease community, such as Access to Genetic Counselor Services Act, which we know is so important for really helping that whole genome sequencing bill that is so important to us, but on a federal level. Further to the right, you'll see a picture of my husband, Troy, and myself, February 28th, 2015, establishing Rare Disease Day in Washington State. And that was really my first foray into advocacy. I was inspired because I unexpectedly lost my best friend, Kelly Seltzer, who had been the first friend I made in my support group and was on her way to an NIH study when she unexpectedly became ill, and due to a great misunderstanding of her rare disease and other sister rare diseases that she had, really led to her unexpected passing. And when I found out that also caused the NIH study to have to end, it really lit the fire in me to say, okay, what can I do just for research to help as much as I can as a patient advocate? Because that gives me such purpose and meaning that it is a big part of my self-care. You'll see on the lower pictures some pictures of us and our Washington group from 2020 advocating in DC during Rare Disease Week, as well as my husband and I doing a fast forward for rare video. We did a few of those yesterday at the fair with a few people, but as others have mentioned, there's no better way than social media, pictures. There's no wrong way to advocate. And great little videos where you're able to be educational on kind of that fifth grade level so everyone can understand. Yeah, I often will describe Ehlers-Danlos syndrome as just stretchy tissue issues that affect every system of my body. And I'll show kids, look, my neck stretches a little bit more than it should. And it really does make a difference being able to use different language depending on your audience and knowing your audience. As long as you answer questions you know and don't answer anything for that you don't know or that's specific about your patient community that you need more info on, use that as an opportunity to follow up with them in the future to learn to create that relationship so that when they see a bill, they think of your face or they think of your family or your story or what you've shared. Just because of the nature of rare disease, we really do have to be our own best advocates and proactively find the best medical care, as well as kind of, as I mentioned, being our own best caregivers. And that looks different being patients. A lot of times I say that my caregiving, or pardon me, being my own best caregiver means having positive thinking, being able to practice meditation, keeping up on my medical care. But due to an unfortunate event, an unfortunate experience where I had a pain doctor who was a male, and on an anniversary dinner, my soon-to-be husband at the time visited the appointment with me, and so I was dressed up in makeup and a dress, and he said, "You can't possibly be in the amount of pain that you're in if you look this way." And for years, I edited myself, how I looked, how I externally presented myself. Because my diseases are invisible by nature, I really felt that I needed to visually convey that some way. And what I didn't realize was how much of a toll that took on not only myself in my expression, but just in being myself and feeling confident and knowing that I'm more than just my disease and my other rare diseases and invisible disabilities. Because we do have passions. Those things, our passions and loves of life don't change when our ability or our health changes. So practicing self-care improves confidence, self-esteem, mental health, and healthcare for everyone. Because when you are your own best caregiver, you can be your best self and advocate for yourself and for others. So a little bit more about just advocacy and awareness being part of self-care and how that became my journey. As I said, there's no wrong way to create awareness and begin advocacy. I started really my advocacy journey with legislative advocacy on federal and state levels. But as I said, my experience with the pain doctor really made me really evaluate how much I was editing myself and really just trying to look like the patient and experiences that I was going through, having pain and other symptoms externally, despite the fact that my word should have been enough to say what my experience was. Now that I have a female pain doctor, she is so much more understanding. If I'm wearing a robe or if I'm wearing a gown about to go out to a gala, she does not use that as an instrument of judging what I am saying about my pain and symptoms and what I am experiencing during that. Whether or not it's art, whether or not it's writing, it's social media, there's really no wrong way to begin awareness. Even if it's just speaking with the nurse who's taking care of you in the moment. I've had many of nurses who are just helping me with my daily IV infusion care for dysautonomia, who I practice my elevator pitches on, who I talk about Ehlers-Danlos and other rare diseases too, because even if they're not maybe the most interested, they are the best people to practice on. And as we just learned earlier from Ryan, you never know whom you'll speak to and what impact and ripple effect that will have. I started my federal advocacy in 2017, attending Rare Disease Week. But it wasn't until 2022 that I learned that Ehlers-Danlos syndrome was added to the congressionally directed medical research program's list of 50 diseases that they work on that are not being met with the needs of the NIH and other research that they want to advance. And in the 9 years of doing this, I never thought that I never specifically asked for that. But to see that growth and development shows that this can be a really long process and that you never know what speech or elevator speech or awareness that you say will impact somebody or will stay with them years longer than you'd imagine. And so after my experience with this pain doctor and gaining some confidence back through my advocacy and awareness, and that really gave me the confidence to be able to articulate what my experience was with my diagnosis in rare diseases without having to edit my appearance and fashion, all the things I love. I know that competing in pageants certainly isn't self-care to everybody, but for me, competing in Miss Wheelchair USA really brought me confidence, self-esteem, belonging, and a sisterhood that I really, to this day, rely on and count on because they all, not only do other of competitors and friends of mine who competed also have EDS or other rare diseases, but they can just innately, like our rare disease community understands each other so well from our commonalities. Just having to use a wheelchair, whether it's an invisible or visible disability, we really relate to each other in a way that gives me such an incredible support system and strength through difficult times or difficult days. And it's through that sisterhood and through advocating that's empowered me to be my pink, sparkly, sequin-loving self without fearing that whatever others' opinions are, that they won't believe my experience of living with Ehlers-Danlos syndrome and rare diseases, especially because of the invisible nature of it. And so to the right, you'll see a couple of pictures from my social media campaign, Practice Self-Care for Your Healthcare, especially since a big part of my self-care is being my pink loving self. And I wanted to show that just because I have EDS and I am disabled does not mean that I'm not glamorous. Yes, I wear bathrobes someday, but some days I like to get really dressed up. And that doesn't take away from my experience or chronic pain at all. Let me move a couple of things so I can see this. And so some lessons kind of about self-care. As others have said, we wear so many hats as advocates, as parent advocates, loved ones, and just even community members who know others with rare diseases, that we have many roles. It can be caregiver, it can be advocate, it can be stepping into having to do that on top of having full-time work and jobs. I'm so blessed that my husband's my caregiver and does all of our laundry, shopping, cooking, driving, etc., on top of working at 3 different theaters and a full-time job at Bellevue College's theater. So it really goes to show that caregivers and spouses and parents sacrifice so much. We know it takes 7 to 9 years on average to be diagnosed and 15 to 17 specialists seen before you get that diagnosis. And that's a long time. That takes a lot of really support, the privilege of having some sort of community or help in caregiving to be able to even get to that point. And so it's essential that we prioritize self-care, not only for patients, but for caregivers, for advocates, for everyone in our community, because that only enables us to be the most effective and powerful advocates that we can. And part of what I've learned is part of self-care for not only the disabled community, but this community is accessibility, inclusivity, and universal design, because really, I think a big part of my self-care has to be planning. Is the space I'm going to accessible? Is it going to have doors that I can open? Is it going to be able to easily be gotten to from parking spot? Do they have enough accessible parking spots that have ramps, or all of these different things? And so a lot of my disability advocacy is part of my self-care, and part of, I'm sure, a lot of the rare diseases self-care, because it is such a big part of our lives, really ensuring that we're able to get to where we need to go, and that we're able to get the healthcare that we need, and be part of live the lives that we want to, and socialize with the people that we want to, because it's accessible and we're able to, particularly with the rare disease community. And more pictures of, on the bottom, you'll see me hosting a SUNY disabilities awareness webinar with other invisible disability members. And above, this picture above, you'll see my husband and I and our very jealous Jack Russell in the window, wanting to be outside in the photo shoot. Thank you all so much for your time. I so appreciate it. And I could go on and on about self-care and how much that ties into advocacy and awareness, but I have shared my contact info. Feel free to email me or reach out to Carolina to reach out to me more directly. I'm always so happy to spend time with members of our community, because self-care and really having to be our own advocates and caregivers sometimes is something that I think we all can relate to in this community. And particularly when you're dealing with invisible illnesses and disabilities, as I am. And I think that being able to have support from other members is invaluable. So if you're looking for anyone to help with support, or if you're looking to get into pageants, I am a Miss Wheelchair USA ambassador currently, and I found so much confidence through it and fun that anyone interested, absolutely please get in touch. They're still looking for a Miss Wheelchair Washington this year. So I am just grateful for your time, and I really hope that you're able to take today and walk away with a little bit more, just knowing that self-care is your priority. It is not only something that is part of your healthcare, but it's something that's going to not only improve your healthcare, but the health and healthcare of those around you. Because the better you are, the better you're able to advocate, and the better those around you will also be.
This has been a very inspiring and motivating conversation. And thank you for always having the courage to be brutally honest about your story. It means a lot to all of us.
Oh, well, thank you all. It means the world to speak, and especially that so many of us, I think, relate to and understand this aspect of self-care and advocacy and awareness. Thank you. And thank you, Lindsay. You've made me teary. I'm just so fortunate to be a part of this group and community.
Our next speaker is an author, life coach, rare disease patient. Janie Reed, JR, has a background in genetics, and she has also written a book about her journey as Joey's mom and the lessons she has learned trying to be a good mom to him. And she is here today to share with us.
Wow, Sarah, thank you so much. I'm feeling really inspired and like sort of just churned up emotionally by that talk. It's so beautiful and so essential. And amazingly, it resonates so much with me as a caregiver. That especially that piece of that, when you said, well, being in a pageant might not be self-care for everyone, but it is for me. And that finding what is essentially us and what is essentially important to us, it's just so life affirming. And we must do what is life affirming. And I also loved how you talked about not just your presentation, but your story, like the words you use to tell your story, they affect how you feel. So I'm going to talk a little bit about that type of thing from my own point of view, which is that of a parent. So you probably, if you were at the fair yesterday, you may have heard me talk about our genetic journey and on the genetics panel. But here today, I'm here as Joey's mom. You can just sort of look at the medical stuff on the slide, but instead of telling you about all his medical issues, what I think I'll do is introduce you to what our life was like, sort of like for the first 12 years of of us not having a genetic diagnosis and of doctors telling me, oh yeah, he'll probably catch up with early interventions. And so me doing all the early interventions and trying to catch him up and him not catching up. So I'm just going to read a little bit about that so you can get kind of a sample of what was going on and what went on for a long time and where he still is now. He's 22 now. He still has these same kind of communications. So this is from my book, More of Everything. It's from the beginning, near the beginning, it's therapies, age 5, maybe this will work. I've been researching for years already. I know about therapies for autism, treatments for brain-injured children, and exercises for the optimal development of neurotypical children. There aren't enough hours in the week to do it all. I make lists and phone calls, trying to find a schedule that includes something that might make a difference, might revive Joey's stalled development. He often sleeps only 5 or 6 hours a night, so skipping appointments won't get me more rest. The clock is running out on the 5 to 6-year-old range that his pediatricians and neurologists suggested for when to start worrying about his lack of speech. It isn't just that Joey isn't talking. He isn't listening or imitating or initiating communication except with a grab when he wants me to do something, or a hit or a bite when he objects to what's going on. I leverage the things he likes, ice cream, swings, elevators, into rewards in exchange for something, anything from him. Sometimes he produces a word approximation or a hand gesture in an attempt at sign language. Depending on the equipment at hand, he also might touch a picture, use an augmentative communication device, point to something I've drawn on a sketchbook, or indicate one of 2 choices offered. When it's not going well, I read his gaze, which follows what he wants, or I look for motion in his body, which is peacefully still unless he really tries to move. Joey qualifies for many types of therapy, and we go. Physical therapists try to teach him to ride a tricycle and sit on an exercise ball. Occupational therapists try to teach him to put pegs in holes and pop bubbles. Speech therapists try to teach him to move his mouth, speak, and understand words. The PT-OT speech triumvirate found in schools and private practice is only the beginning. I find a European-trained developmental specialist who uses a form of listening therapy and other sensory movement activities to try to grow up his nervous system. I find horseback riding that wakes up his core muscles. Hippotherapy turns out to be the hour of each week when he's the most engaged with others, at least for the first 4 of 6 years that we go. I find floor time OT the modality that teaches me the most about how to understand and interact with Joey. It's so helpful that we go for 12 years. I learn how to join him where he is and stretch his capabilities with playful obstruction and good humor. I learn how to accept where he is in the moment and resist extrapolating his growth curve. So that kind of gives you an idea of what our life was like, a lot of therapies, and I had 2 other kids who were driving around a lot. And yesterday, Effie talked about BF, before Ford. And I think that no matter what, we all have some of this in our lives, some of this like sort of before and after. And so I just wanted to drill down into this a little and talk to you about what was my thinking before and what is my thinking now. And I'm going to tease out some of the specifics. And I guess first I should say that I know I am privileged. My child has a neurodevelopmental disorder, not a neurodegenerative disorder. Okay, that is big. That's a big difference. My child is not in constant pain. Okay, so I have a 3rd level problem for my child. I mean, I'm just talking about my values as a parent. My biggest value would be, is my child surviving? My second value would be, is my child in pain? My third value is he developing? Okay, so it's my 3rd level value that's not happening. He's not developing. So I realize that, and I don't want to, I just want to honor that right now. Also, these kinds of things are going to be specific to each rare disease. They're going to be specific to each stage you're in. Like, you heard how our genetic diagnosis wasn't until we were 16, until he was 16. So some people are getting a diagnosis when they're 2, and you're not seeing that they haven't they're not 5 or 6 yet, not talking, right? They're just 2. Is that there's a thumb up? Is that a question or is that just a thumb up? I think it's just a thumb up. Okay. And then this also is going to be specific to everyone's unique expression of personality. Joey has a very specific personality. It's going to be unique to your expression of disease and specific to your values as a family. Oops. Oh, so it just went the other way. Okay. So first one, Joey didn't sleep. You can say that. It's hard to imagine. He really did not sleep. And so my thinking before sleep studies and surgery to take out his tonsils and adenoids because of his obstructive sleep apnea, my thinking before is I must get Joey more sleep, right? I have to get him to sleep. My thinking after years of trying and failing was that I need to keep Joey safe while I sleep. Like I still needed sleep, right? Just because he wasn't sleeping didn't mean I didn't need it. And that is a big shift. That's a big shift to kind of accept, well, no one seems to be able to help this person sleep and I still need it. So I've alluded to his self-injurious behaviors. My thinking before he had self-injurious behaviors was I must enrich Joey's life. I really had this kind of deficit thinking of like, oh, he's not going to be able to do these things, so I'm going to have to enrich his life to make sure that he has a better life than he could just being able to do less, right? He can do less, so I better enrich his life. My thinking after his behaviors, his self-injury and his aggression, especially towards me, when they were out of hand, they were frightening, they were not manageable. My thinking was keep Joey safe and engaged with neutral emotions. I'm not sure how many people are dealing with a child whose emotional regulation isn't there, but in case there is anyone out there, I just want to mention that I think that what is kindness for Joey? I think kindness for Joey is consistency. And it really is keeping him engaged with neutral emotions. Too much anticipation, too much hilarity, too much excitement. It all looks and sounds painful and it ends poorly. Like it kind of seems okay in the minute, but it doesn't lead to good things. And keeping him, like we all want to see our kids happy, but seeing Joey super happy does not lead to good places. Seeing him stressed out does not lead to good places. Seeing him with neutral emotions and engaged, seeing him in that magic land of actually being able to do things, that's what kindness is for him. All right, so I didn't learn about SYNGAP biology until after our genetic diagnosis. So when he was 16, 17 is when I really was reading the papers and going to meetings and figuring it out. So my thinking before learning about this biology that he has was I must help Joey develop. I was a developmental biologist. Like I love development. It's like the most fascinating thing to me, and I really must help Joey develop. My thinking after learning about it is that treatments, specific precision treatments, may someday help Joey develop. Like Joey and I together are not really up to the task of changing his SYNGAP biology. We can try to have the best life we can together, and I work very hard at that, and we do really, really well at it. But that does not mean overcoming the biology of what's going on inside my precious, princely, soft-skinned boy. And then I just want to say, like, the sort of entire sort of gestalt, my default frame of mind really in the before times was an extreme sense of responsibility. Parents always feel responsibility, right? But this was like a very strong sense of responsibility, plus the helplessness that comes with seeing a problem that you don't know how to change, and you gather all the experts you can find, and nobody has any ideas of how to either the people are saying, no, that's not true, oh, we don't care that he only pees twice a day, and no, we're not going to do a what do you call it, an ultrasound of his bladder because we don't care that you're telling us that he pees a lot. All kids pee a lot. It's like, no, like there's no urologist that has believed me that this is an interesting case for them. There's no endocrinologist who said, oh yeah, I did notice that SYNGAP is expressed highly in the pituitary, and the fact that your son doesn't sweat, can't regulate his temperature, never gets goosebumps. Yeah, that's actually kind of interesting. Maybe I should be looking into this, right? Like there's like, people just don't care. Like we have a rare disease that is undertreated medically. People are interested in the seizures, but we can't get the EEG on them anymore. So we're just in this hole of trying medicines, that aren't really helping. So anyway, responsibility plus helplessness. So what's my intentional framework now? Even though I just went on that rant, I try not to do that. I try to stay out of that. And I just try to say, what is my unique role? And it's our relationship. I really just try to focus on my relationship with my son. And be his guardian, do take him on, take him to doctors. Like I do try to do all that stuff, but I try not to measure my success with the medical side. I try to only measure our success with our relationship, which again is hard with a teenage boy or a young man. So I'm going to try to. I'm not sure how much time I have. It looks like it's 11:41 right now. I'm not sure if I should just stop or if I have a little more time.
I'll try to catch us up so you keep going.
Okay.
Leave the time part to us.
Okay. So I'll kind of go fast through these, but I do want to take a little bit of time. What it took to be a better parent with a focus on Joey. That's lots of learning from doctors, therapists, really great babysitters, teachers, behaviorists, right? And the whole rare disease community. I think this is where we all are together. This is where the whole rare disease community is. What did I personally bring that I think might be interesting to others that maybe they don't have? I have lots of observations of Joey and lots of faith in my understanding of him. And I just want to talk about where my certainty comes from in my observations. I said I'm a geneticist, developmental biologist. I was both those things. I have a favorite quote from a developmental biologist, which I bet nobody else on the call has. So my favorite quote, I'm going to read it first, and then I'm going to translate it into how I think of it as a parent. So the quote, and what a developmental biologist does is they look at a fertilized egg and how it turns into an embryo that you recognize. So let's just talk about vertebrates. They have a face, they have eyes, nose, mouth, they have ears, they have a neck, they have a spinal cord, they have appendages, they have fingers, right? Like they have all these things, right? It goes from a fertilized egg to this thing you recognize. And it could be a frog or a chicken or a mouse or a human, but they all have that same pattern. So here's the quote. Our real teacher has been and still is the embryo, who is, incidentally, the only teacher who is always right. So this was a sign that was up in every lab I was in, and I really loved it, and I really believe in it wholeheartedly. And so the way I read that as a parent is my real teacher will always be Joey, who is always right. And the people that I trust are the people who are looking at Joey. So when I go to a doctor, I trust the doctors who are watching him. When I go to a therapist, I trust the therapists who are looking at him. I don't trust the people that say, oh, he'll learn because everyone else I have has learned. Oh, he'll do this because I read about it somewhere. Okay, so observing my own kid, that's really primary to me. And then the follow-up thought from that is even more important. From his perspective, his behaviors make sense. My job is to try to understand him. So when he's biting his hand, I have to try to even he bit his hand from a very young age, didn't harm him at all until he was about 8 and started breaking the skin. But from age 2 to 7.5, 8, he would do it, and I could tell this was going to go poorly, right? I could tell this is not going to go well later, but I couldn't necessarily. I tried to figure it out. I tried to have him stop doing it. I couldn't really do it, but still, I have to think from his perspective. This is making sense somehow, and I have to figure it out. So what do I try to observe in Joey? I want to figure out what activities he likes and why. Why does he like them? That really helps me. I try to look at when is he the most peaceful and relaxed? What are those situations? What is the exact environment? What are the sensory inputs? And then I try to look at what does he get from others? I don't have a kid that is social. I don't have a kid that wants to high-five anybody. I don't have a kid that imitates anybody. I don't have a kid that listens to anyone or looks at anyone else's face. So I don't have that. I mean, there's a lot of great things about Joey, but I don't have that. But this is how I try to figure out what to do with him and how we can have a good relationship. So what it took to be a better parent with a focus on me, this is a lot of what you're going to find in my book. This is a lot of what Sarah just talked about. So I'm not going to go over that because you can read about that somewhere else. And I'm going to just say quickly what it took to be a better parent with a focus on us as a dyad. It took lots of trials to see how Joey and I can connect with each other. Lots of trials aren't hard. It's not hard to try with your kid. What's hard is to get over the disappointment of the times it doesn't work. So if you can shift your mind to be that, sociologist, archaeologist, whatever you want, anthropologist, and not be disappointed that the things didn't work, it's a lot easier. Just keep trying. Try different things, and keep observing. Observe when are they happy? When are they relaxed? When are they feeling good? Try to do more of that, and then observations to see what we both enjoy when we're both fulfilled. Like, it is easy to see when he's happy. When do I put myself in that equation? I'm too busy to think about having fun. I'm thinking about 3 other things down the line. Like, I'm anticipating everything. Like, I know if I'm bored, but I don't know if I'm having fun. It's like fulfilled. That doesn't make any sense. Like, we're busy, man. Like, we don't have time for this. So anyway, it's just trying to figure out if we're enjoying something and if we're fulfilled. That's a real shift to actually listen to your own heart and see if you're having fun together. And then through OT floor time, I really learned a lot about using humor and pauses. And that works a lot with me and Joey. And then, of course, gratitude. Gratitude always helps everything. So when we're aligned and happy, having a positive experience together, Joey feels it. If I say to Joey, "You're so great. I'm proud of you. I love you." That doesn't mean anything to him. I could have said, "It's raining in Spain." Doesn't mean a thing. Especially if I'm worried, afraid, tired, disappointed, right? We have to be aligned and happy and having a positive experience to have a good relationship. That means I have to feel good. How am I going to feel good? That takes this really radical self-care. Okay, here's the paradox. I still want them to develop. Of course I do. Of course I do. I just try not to focus on it for my own success because it doesn't happen. It's not successful. So I focus on our connection because it's how I have success and it's how Joey feels honored. This is my book. It's called More of Everything. You can get it on Amazon. It's in paperback and in Kindle, and it's actually now on Kindle Unlimited if you have that, so it's free there. I want to be sure everyone knows, if you want this book and you don't have the money to buy it, email me. I am emailing anyone who wants it a free PDF, like, for sure. This is not a moneymaker for me. I mean, it is. This is my job, but this is not, I'm not gatekeeping this information. And here's some ways you can get in touch with me. jr@kirstengap1.org, connect@janiereed.com, and I'm Janie Reed on Facebook. Also, JR's my pen name, so some of you know who I really am. It's about privacy for my family, and I don't think anyone's touched on that in the Rare Fair, but for some people it's important, for some people it's not.
I'm glad that you wrote your book so that I can have time to go back and reflect. And I almost feel like you kind of gave us all permission to look at things differently and just own what is our truth and what really matters of the reality of what parenting might look like for those of us with children with rare disease. So thank you so much for your time and for sharing with us.
Oh, thank you. Oh, and I should have said Effie Parks, who has Once Upon a Gene, she interviewed me on her podcast. So that's number 184. If you're a Once Upon a Gene person, go to number 184. You'll hear all about the book. And that actually, the show notes there have tons of things that I either wrote about genetics. If you're looking into, if you want to know more about your own genetic report, that's something I'm passionate about, or other stuff like that.
That is awesome. Thank you so much. Where would we be without Effie Parks and the Once Upon a Gene podcast?
No kidding. Kidding. She gathers everyone.
Our next speaker, Christina Newell, is a licensed mental health counselor, former art teacher, and rare disease patient. And we had the privilege of getting to meet her and her son yesterday and really just enjoy some time with her. So thank you so much for being here today, and we look forward to hearing from you.
So our agenda, I'm going to talk about myself because it's my favorite topic, right? And then I'm going to talk about making art and how that is useful for everyone and for kids and adults. And then I'm going to make you all do an exercise because, we've all been talking this morning, and it's great, and I love it, and so much amazing self-care talk has happened, but you have to do some too in order to make it real. Okay. So, I am Christina. I grew up in Alaska. I was an art teacher for 5 years. I moved down to Bellingham. And I used my second graduate degree and became a mental health therapist. As an art teacher, I quickly realized that having a classroom of 30 kids at one time is not appealing, and I much rather work one-on-one and have individual kids to talk with instead of having 30 of them at once, because I don't get to know everything that's going on. Okay. Okay. So this is me now. Well, I have purple hair now, but I am a counselor. I specialize in clients with chronic pain and rare disease. I also specialize in therapeutic art because I was a art teacher and now I'm a therapist, but I don't do art therapy because that's a whole nother school that I'm not going to go to. So I am an art teacher. I am a counselor that specializes in therapeutic art and in chronic pain and rare disease. I can work with anyone who's in Washington State. I do a lot of teletherapy. It's really great and it's rewarding, but that's part-time. And it feels really good to be doing it part-time and not full-time as I was, as I now have a rare disease as well. And so that is another part of what I'm doing with the rest of my time. I'm a support group leader for the Northwestern Washington Ataxia Support Group. I've decided to call us the Yetis because that other thing is a whole mouthful, and Yetis felt appropriate. My brother even designed us a logo, so if you go to the website or the Facebook page. You can see our logo. I'm going to put all these links in the chat, but I can't get to the chat now because WebEx is fun. Okay. I'm also on the mental health task force for the Northwest Rare Disease Coalition. I've been on it for a year now, right? Since last fair is when I decided that I wanted to be involved. And so, yeah, Carolina recruited me, and yeah, Carrie and I are doing it. So it's been a thing. I created this. This is actually my website that I created that you're looking at now, because I wanted to be able to reach out to everyone with just one website. Because it's like, okay, I have ataxia support group people, I have rare group people, I have counseling people, I have the self-compassion and mindfulness through drawing class that I'm teaching for the Rare Disease Coalition, and it's been really fun. I'll talk more about that later. But I also have, on this website, this list of memes that I like and links that are some of my favorites. And so, I have notes on this page. So I want to talk about mindfulness because everyone's been talking about self-care, but self-compassion and through that, I teach a lot about mindfulness is so important because it's how we do this. It's how patients and caregivers, loved ones, and clients and everyone, how we get through each day. Research has shown that mindfulness is extremely effective against a variety of mental health and physical issues. Tools like mindfulness should be added to your daily practice, as mental health issues are on the rise like never before. From a neuroscience standpoint, we know that mindfulness helps the brain because it calms the nervous system and also helps brain connectivity. Brain connectivity is the brain's ability to talk to itself, and it is needed for lots of things, such as regulating behavior, emotions, for learning and the processing of information and memory. We know that research shows that in as little as 40 days, if you do 10 or more minutes of mindfulness or meditation a day, you can make lasting changes in your brain. So, what is mindfulness? Mindfulness can be eating mindfully. You can pay attention to all the senses when you're eating. You can go for walks. I walk my dog every single day because he weighs 90 pounds. And if he didn't, he would probably eat us. But, I go for dog walks every day and I pay attention. You can play mindfully. You can play video games mindfully, not all the time. You can garden mindfully. You can bake mindfully. You can take a bath mindfully. I know self-care is all about taking a bath, but sometimes it is. Sometimes it can be. You can watch TV and just pay attention and do it mindfully. Okay, next slide. Do this. So kids are often able to be better at being mindful. During the beginning of the pandemic, my son and I would go on Pokemon walks every day. We would go capture all the Pokemon. We would pay attention to what Pokemon were there, how many Pokemon we needed to evolve to the next level of Pokemon, and just all the numbers. And that was a great way. But, as Carolina just said, making art is a great way to relieve stress. There's so many ways to do art. And creativity is one of my top fundamentals in how to make things better. So finding your way of creativity, whether it's making art, whether it's baking, or, I like people who bake for me. I don't do that much, but really cool when people do. Okay, so These are a bunch of my memes and GIFs that I have collected and I think are amazing. I have links, all of them had different links. And yeah, I feel it's an important part of being happy and being aware of yourself is being able to make fun of yourself. So yeah, if you will link to my website at the end and you'll be able to go and check out where all these lead. But there's some pretty good leads. So I'm sorry. Awesome. Okay. Okay. So walking is important. It's a rhythmic activity. It activates the parasympathetic nervous system. It helps you release anxiety and feel relaxed. Drinking water, as my meme says, drinking a gallon of water helps you avoid people's drama because you're too busy peeing. And so that's important. And as I always tell my clients, if things get too stressful, just go to the bathroom. It's always an option because no one's going to say, oh, you can't go to the bathroom right now. You can always just go to the bathroom and then just say, hey, I gotta go. And in the bathroom, you can do whatever you need to do. Catch all the Pokemon. We gotta catch them all somehow. You can do a drawing technique. And so now I'm going to talk about this first. So this is my mindfulness class. We started out an hour once a month, and now we've decided that 30 minutes is good enough because so many people are in such a schedule. And this is 30 minutes once a month. And Carolina's joined me a lot. My mom joins me every single month. And, we've had other friends, I've had clients, and it's just a great way to be able to relax, enjoy company with others, and just not focus on yourself. But at the same time, focus on yourself in the best way possible. Just being able to ground yourself and to know where everything is and just be able to do it. Okay, so I'm going to try to magically show a video. It's going to be awesome. Okay. Expand my view of what I'm sharing. Meeting controls. Okay. So we're just gonna do it this way. I'm not gonna show the video. I'm just gonna do it myself. Because I can. So this is my magic whiteboard. I have many. So I want everyone to grab any kind of piece of paper, doesn't matter what, and some kind of writing utensil. It can be lipstick, it can be eyeliner, it can be a pen, it can be a pencil, it can be a crayon. Doesn't matter what. You can even just use your finger. So thank you, Lindsay. You can do this. Yay! Okay, so what we're gonna do, we're gonna draw our breath. So we're gonna start on one side. We're just gonna see how big lines we can draw. Okay. And that's self-compassion through drawing. So, yay, Lindsay has lines. Cool. So that is one technique that I like to do. We start every single self-compassion doing that redrawing class because it's so important, and breathing. And I love that because it's grounding as well. So if you don't have paper, you can actually use your hand and go. And I am very comfortable with breathing in front of other people because that's what I tell people to do every day. So breathing's important. It makes us human. And that's really important. I remember once when I had two kids, and the older one was about to get in trouble, the little one would start breathing. I'd be holding the little one, he'd be starting to take deep breaths because he knew that's what I was going to tell the older one to do. So I'd have the little one going because he knew that was how I needed to help the older one regulate. So it's important. Keep breathing, and we can do this. Okay, thank you. I will drop all these fun links into this, and it's been great.
We are going to be hearing from Carolina, but also the person that helps to make all of this possible, who we haven't heard a whole lot from quite yet in this weekend, David Summer. So he is the Vice President of Born a Hero and is forever grateful to be married to Carolina. He is the founder of the Born a Hero and Northwest Rare Disease Coalition. And together they have 2 children, one of which has Pfeiffer syndrome. In his professional life, David is a structural engineer working on improving seismic resilience of buildings and communities. He recently returned from Turkey, where he had led a team studying the damage from the February earthquakes. Carolina has the dreams and the ambition, while David brings in practical considerations. It couldn't be more perfect. So thank you both for joining us to talk to us about tiny habits, how to get done what you've always wanted to do.
Thank you. As Lindsay said, I'm David Sommer, married to the amazing Carolina, who's been putting on everything that you've seen so far. And I just keep the kids out of the way so she can do her work. But we're going to talk about tiny habits, and so let's get started. I'll do the sort of explaining piece, and then Carolina will actually walk us through how to create our own new habits. So before we start, I want everyone to take a second, sit up straight in your chairs. Take a couple deep breaths. All right, good. Now pat yourself on the back. Okay. How many of you did that with me? Can you either raise your hand or turn your video on? Okay, it looks like a good number did. Great. So, what just happened? How did I get everyone here to sit up straight, if you're physically able to, and take some deep breaths? Am I doing some mind control? It sounds silly, but no. The factors that played into these behaviors happening were, first of all, motivation. We all have the motivation to have good posture and to relax. Almost all of us have the ability to do so. There are some who are not able to sit up straight, but if we're able to, then it's very easy to just adjust our posture. And there was a prompt. There was me saying, everybody sit up straight. And so when those 3 things happened, there was the behavior. All of you sat up straight and you took some deep breaths with me. So we're going to use that as an illustration of both tiny habits and behavior design, which is the other piece of this. And we also had a celebration afterwards. So We feel good about ourselves for doing something that we wanted to do, and that helps lock it in. Why are we talking about this? I think you all know caregivers and patients carry a heavy load. There's a lot that we have to deal with. And we all have things that we want to change. There's things that we want to start doing. There's things that we want to stop doing. Often what we do is we set big goals, we try and make big changes, and then when we fail, we're very quick to blame ourselves. It's easy to get down on yourself when you don't accomplish something that you set out to do, especially when you see online all these people that are doing what you're trying to do. So we need a better way to create some lasting change. The method that we're going to be talking about today is called Tiny Habits. This is not something that we came up with. It's based on a book that Carolina and I are reading together called Tiny Habits. It's by B.J. Fogg. He's a professor at Stanford. This book is available on Amazon. It's like $13 for a soft cover. We started reading it from the library. I'd highly suggest that if our talk interests you, that you go seek out a copy and read through it, because there's a lot more information inside this book than we're going to have time to get to today. But let's talk about some of the basics from that book. The first is, how do we understand behavior? We just were talking about motivation, ability, prompt, but what does that mean? Well, let's start with a graph, and this is not going to be technical, but on the horizontal axis, we have ability. On the vertical, we have motivation. And for ability, we're going to say the left is something that's very hard to do. On the right is something that's very easy to do. For motivation, we can have low motivation or high motivation. And there's some sort of a curve that relates those two together. And we'll call this curve the action line. And if you have an action that is easy to do and high motivation, then if the prompt happens, you're going to do that behavior. If it is hard to do and you have low motivation for it, and you get a prompt, you're not going to do it. If I had said, everyone sit up straight, and you said, no, I hate sitting up straight, then me prompting you to do that would probably not make you do it, right? So there's some relationship between all three of these. We say that behavior equals a combination of motivation, ability, and prompt. As I said, the author of this method is a professor at Stanford. He's done research on this for many years, and the studies back up these findings. One thing that I really like about this method is that it removes blame. Instead of saying, I fell off the horse and I wasn't able to keep up my habit of whatever it is, eating healthy or eating fruit at every meal, and then getting down on ourselves for not having the right motivation or not being strong enough, whatever it is. It's more of a science experiment, right? It's, all right, I set up this combination of motivation, ability, and prompt. That didn't work out very well. So what can I tinker with to make it successful? Can I adjust motivation? Maybe not. Can I adjust ability? Can I change my prompt? So it really allows you to go in and find the right combination that works for you. Let's take an example here just to illustrate the graph. Let's say that you want to go to the gym for 1 hour every day. That's a great goal. It's a great thing to do. And maybe on New Year's Day, you have real high motivation. You made this resolution. And so you do it, and you do it for that first couple weeks. It's a hard behavior to do, going to the gym for an hour every day. And so what happens the day before a work deadline? You don't have much time. You're stressed out. You're tired. Your motivation has dropped. Your ability is still the same, but you're now falling below that action line. So a lot of times that's where we fail. Now let's scale this back and make it into what we call a tiny habit. Let's say your new goal is to do 5 squats while waiting for the shower to warm up in the morning. This is not equivalent to going to the gym for an hour, but it is still a good thing for you to do. It's a step along the path to being healthier, and it's much less of a commitment. So on New Year's Day, you have that real high motivation, but look, we've moved all the way over to the right into the easy to do section of the graph. And so on New Year's Day, you do it, and maybe you do extra credit, right? You'd say 5 is too little, I'm going to do 20, and that's great. Day before the work deadline, you're still hopefully taking a shower. You still have to wait for the water to warm up, and while you're doing that, you might as well do the 5 squats. Even though you're tired, you're not feeling it, it's so easy to do that when you have the prompt of the shower starting, you still do the behavior. So the method or the model of tiny habits is after I blank, I will blank. So after something happens, I will do this behavior. And the goal is to make that something that can be accomplished in about 30 seconds or less. Something very small, something that you can do on your busiest day. So a couple examples, we'll come back to these later when Caroline is talking, but one that she and I do a lot is when we wake up, we say, today is going to be a great day. And I think about what about today is going to make it a good day. When I get back to my desk after lunch, I set my Pomodoro timer because I have the afternoon slump, and so that helps me get it through. After I serve dinner, I'll put the remaining food in Tupperwares. This is actually an example of one that I tried and didn't work. We have 2 kids, and putting all the food away right after serving is not always something that was easy to do, so it didn't work. And that's okay, because it's not a fault of my character or my strength. It's just I need to adjust what we're doing in some way. And so we're still playing around with that one. For caregivers, again, a couple examples, and we'll put these slides up at the end. But after I email the doctor a question, I will make a note of what I asked in my care journal. That's it. After I help my child do physical therapy, I will compliment them on one thing they did well. After I get frustrated with the healthcare system, I will think of one friend I can call for a listening ear. You don't have to call them. You just have to think about, who can I call? If you call them, great. Examples for patients. After I experience pain or discomfort, I'll remind myself it's okay to struggle and offer myself words of kindness. After I put my dinner plate in the sink, I'll think of one thing I accomplished today. After I get ready for bed, I'll open a meditation app. Just a couple examples. Again, we'll put these up later, and you can look through them a little bit more. So now that we've talked about sort of the tiny habits method overall, let's drill down into the different components that we said make up or influence our ability to do behavior. So the first one was motivation. And motivation can be a tricky one. You know, as we saw, there's a big difference between New Year's Eve or New Year's Day and right before a work deadline. So we get these motivation spikes, and those are great. It doesn't mean that we should set ourselves up for, assuming that motivation is going to stay constant, but we can use those motivation spikes to plan out what behaviors we want to get done, what tiny habits we want to do to accomplish those behaviors. We can also use those spikes to get tools. I haven't talked to Carolina about this yet, but I was looking this morning about some sort of exercise device I could put under my work desk so that I can do a little more physical activity during the day. I was motivated because I was thinking about this talk, to be honest. Or we can use those spikes to learn different skills. You can watch a YouTube video, read a book, something else that will get you further along in the process of doing your tiny habit once you get there. But we need to understand that motivation is not sustainable. It's not something that you can rely on every day because motivation goes up and down. And if you do, it just sets you up for blame and discouragement, as we've been talking about. So when we're picking what behaviors we want to try and do, what tiny habits we want to try and set for ourselves, the first thing we need to think about is, am I going to enjoy this? Right? Motivation is a piece of it. It's not one that we want to rely on, but we do want to have a behavior that we want to do, that we're motivated in some capacity for. So let's say you want to get in shape and you think back to a couple years ago when you were running and how good that made you feel, just being out in the fresh air. That's great. Maybe running is what you want to work up towards. But if running, just even the thought of it makes you want to cry, getting in shape is a great goal. Maybe running is not the behavior that you want to try and pick. So it's not about what behaviors you think you should do. It's what behaviors do you want to do that will move you towards the goal that you're looking at. Likewise, it matters if the behavior is actually helping, right? So if your goal is to get better sleep, maybe you think, I will buy a white noise machine because I think, I've read all these studies, the sound of rain at night will help me sleep better. If that works for you, great. If you're the kind of person like me who's a light sleeper and any kind of noise will just keep you up, it's a good try, but that's not a behavior that you want to keep trying to move towards, or a tiny habit that you want to use. So if we look at another graph, again, not technical, but we have high impact behaviors versus low impact. So, for example, the rain machine, right? And then we also have, can I get myself to do this behavior? Yes or no? We want to be in this upper right corner where it makes a big difference, and yes, I want to do it. Those are going to be the easiest behaviors to get myself to do. And so when motivation dips, I can still get these behaviors done. The next component is ability. And so we can really adjust ability to play with our likelihood of doing these behaviors. But a lot of times when we fail at creating a new habit or accomplishing a behavior, it's due to one of 5 things. And so if we ask ourselves, what's making the behavior hard to do? Often it's time, money, physical effort, mental effort, or fitting it into your routine. So if you can identify which of those components it is, then you can try and adjust, again, toggle different things and find what works best for you. And then the reason this is called tiny habits is, how can you make the habit easier to do? There are 2 techniques that Tiny Habits discusses. They're called starter steps and scale back. So let's look at each of those. So a starter step would be, it's like the name suggests, the first step towards the behavior that you want. So if you want to walk a mile every day, maybe your tiny habit is, after lunch, I will put on my walking shoes. If you put on your walking shoes and decide it's raining outside, or it's too cold, or I'm too tired, and you go back to work, congratulations, you still accomplished your habit. If you do that every day and you put on your walking shoes and you start walking 2 times out of the week, that's fantastic. You did 2 days of walking more than you needed to accomplish your habit, and 2 days more than you would have if you hadn't put on your shoes. It can also be something as simple as opening up an app. Let's say you have a mindfulness or a meditation app on your phone. If you say before bed, I will open up this app, you open it up, you decide, I'm really tired, I don't want to do this, and you close it, you still did great. Scaling back is another way to try and accomplish our habits and simplify the ability side. So let's say you wanted to try and do 100 push-ups. Well, even if you have high motivation, your body may not physically be able to do that, especially at the start. So your ability is way on the left side of this graph. So let's say for scaling back, instead of starting with the big thing, we say, all right, my goal is to do 2 push-ups. Maybe that's doable. Maybe you really can't do any push-ups right now. Then you move to 2 push-ups against a wall. And as you do that, maybe in a couple weeks, you adjust your habit to say 10 push-ups against the wall, or you increase the incline. And then you start to shift down to normal push-ups, and you can grow from there. But scaling back is whatever you do, if it's 2 push-ups against the wall, that's more than you would have done without this habit. And so you're doing great. You can also use ability to your advantage if there's something that you want to stop doing. So one thing that I had found myself doing a lot of times was scrolling on my phone at night when I really should have been sleeping. So what I did was I got a charger for our kitchen, and I plugged my phone in there, and then I bought on Amazon this little $10 alarm clock that I plug in next to my bed. So making something harder to do makes it less likely that you will do the behavior that you don't want to do, such as scrolling on your phone at night. The final component of these behavior models is the prompt. If you don't have a prompt, you don't do the behavior. If I had not said, all right, everyone sit up straight, you would not have sat up straight. Maybe at some point you would because you feel yourself getting uncomfortable or slouching. That is also a prompt. You'll feel something inside. You should be experimenting with different prompts, find out what works best for you. A really good way to do it is to anchor it to an existing routine that you have. So, like I said, turning on the water for the shower in the morning, or you put your dishes away after lunch, or you get into bed, something that you're going to do every day, and then you can follow that with the tiny habit that you want to do. And it can be an emotion. As I said, it can be something that you feel. After I recognize that I'm sad, I will think of something good that I did today. And then the final step is to celebrate, because if we feel good about ourselves, then we're more likely to keep doing something. So there are lots of ways to celebrate. It can be just a 3-second celebration, but smiling, patting yourself on the back, do a little dance. Carolina can show you one of those right now. Yeah, that's embarrassing. You can just shout yes. You can pump your fist in the air. You can play your favorite songs. You can flex your muscles. Whatever you want to do to celebrate, that will help lock in the behavior.
So I just want to say that thanks, Heavy, for just doing such a great job of explaining things. You can see kind of our balance in our life. I'm the woo, and he's the, keeps us straight and calm, and and all this stuff, all that good stuff. So I just wanted to see if we have a few minutes. So I wanted to take the time to actually go through some of these things with you guys that David talked about. And I will say one of our prompts is, I think, like reading it together has been really special, and because we were able to discuss everything together. So I think, just to throw it out there, I guess. And so the first step so if you guys can get a piece of paper and pencil, that would be great. Or if you have something next to you that you could write. I'd like to kind of go through it with you. So I'm going to clarify something between two things: aspiration versus behavior. So aspiration is like the end goal, versus behavior is what do we get to your goal, right? How do we get there? So these are kind of examples of aspiration: lose weight. So you have to think about them more specifically. Are you thinking about losing weight, or do you want something more specific? Like, would you rather want to feel better in your clothes, right? Or so you're really just thinking about what that is. So think about maybe 5 examples, and then you can kind of pick your top 3 favorite. So improving your spiritual life, get stronger physically, be more productive at work, be more patient with your kids, have better dental hygiene, reduce your stress. So think about what some of those might be. Just start jotting them down. I'll give you guys a second. I guess maybe just pick one so that we can kind of develop it throughout. Okay, I'm going to go to the next slide, babe, please. Okay, so step 2. Sorry, I know I'm kind of rushing through this, but we don't have a lot of time. But so I know I should give you guys more time, but yeah, so just write it all out. Try to pick one. This is just so that we can, I'm trying to get you so that you guys can practice something, but see if you can pick one of some of the things that you've written down. So I'll just keep talking as you write ideas. I chose reduce stress as one thing. It's shown that stress can increase the risk of heart disease by 40% and the risk of heart attack by 25%. And I have heart issues, so I think this is something that is important to me. So that's one idea that I have out there. So, so the type of behaviors that, I didn't actually write them here, but types of behaviors that could help with this. Maybe it's meditation or yoga, maybe it's practice exercising regularly or connecting with others, or I don't know, there's just different types of things that that you could put on there. I don't know if you could just write a few behaviors that you think might help with your aspiration, with your goal. Think about, yeah. And again, you're going to be able to do this at home or hopefully afterwards, but if you can. But next, baby, please. So the next part, so that's how I like to do it. So first you think of your goals, then you make your little bubble, and then try to figure out all the behaviors that might help you figure that out or might help you accomplish your goal. And then you do focus mapping, like David had talked about. And so the high path, so this is what he calls the focus mapping. And it's the high impact, I just want to clarify, are the things that are very effective at helping me. The things that are in the low impact are not affecting and helping me at all. And on the right side, as you can see, I can get myself to do this behavior versus to the left, I can't get myself. And you kind of want to be like where David said. You want to be, that's kind of where the golden behaviors are. You want to make it something that's effective and something that you can get yourself to do. So for me, maybe going to the gym is not something that would be very effective. So even though I wrote that on the bubbles on behaviors, on something more that will lay on the kind of goes on the left side because I don't have the time to do a gym. And then meditation may be not something I can do usually because I'm really bad at sitting still, but maybe it's something I can work on with. But I could do things like practice gratitude or and maybe I don't go to the gym, but maybe I could do 30 minutes at home workout. And so those are kind of things that would help me with my stress, right? That are more tangible. And you can always just really scale back and go smaller. So think about what you can put on the top right. What is effective? What can you get yourself to do? And I think that as you do these more and more, it's going to get easier and easier to think about these things. But it really does. It really has helped us so much. Okay, step 4. So starting tiny. So now you've written your habits and you have your golden habits. And again, I was saying like, instead of 20 push-ups, I will do 1 push-up. So then you go back and you sort of modify it and make it tiny, right? Is it 20 push-ups or am I just going to start with 1 push-up? Or maybe even go micro. Instead of 1 push-up, I'll start with push-ups against the wall, or instead of drinking 8 glasses of water, I'm going to drink 1. And even tinier, I might just put my water bottle in my purse Or instead of meditating for 30 minutes, I will meditate for 5 minutes. I could do meditating for 5 minutes. But maybe if that becomes too hard, maybe instead of meditating for 5 minutes, I can take 3 deep breaths. That's something that is even more manageable, right? So you could really scale it back. And I think, and so like David was saying, you start really small, really small, and it seems really silly at first, but like you feel so proud when you can just do that part. And a lot of times you'll actually do more, right? And so you won't feel bad about it because you have done what you said you set yourself to do, right? So you'll still feel proud, and you might even do more anyways, right? But then you don't feel bad, and you've done it. So think about how you can make those tiny. And so I guess for me, it just helps to break it down into these steps in my mind. We have different minds, David and I, so it was funny just coming up with the slides because we saw it differently a little bit and how we put it in our brain. So, okay, step 5. Thank you. So again, like he talked about, finding a good prompt. After I will, after I will kind of mentality. So you have your tiny habits, and now how can you incorporate them into your daily life, right? So for one of the habits that I wanted to put for stress is my faith. That really helps me. And I was like, how do I include prayer into my faith, into my tiny habits? And one thing that I use it in my daily life is like after I drop the kids off, I'm in the car and I'm driving and not doing anything, and I'm able to listen to my mass and listen to a homily or something, and it's not taking any more time from me because I'm going to be in the car no matter what, and so it doesn't really change, but it really impacts the rest of my day. So just think about, how you can incorporate it. And like I said, one of the things David said, after we get up, we say it's going to be a great day. And that takes a few seconds. And it really, really has helped both of us so much. And it's really, the prompt is you put your feet down on the floor and you say it's going to be a great day. And so that's something that we can do. And all of these things, sorry, sorry, our dog is going crazy. Somebody's at the door. All of these things start really small, but the nice thing is that as it becomes a habit, again, you can grow and grow and grow them with time. But okay, next. And then I am not really as good about celebrating stuff. So I just my favorite is just smiling. I smile at things. I'm not as good about celebrating, but I do believe positive reinforcement is important. You can do this through songs, physical, verbal, sound, and visualization. So anything that works for you. I usually just smile. And sorry, babe, step 7. And again, we kind of sort of talked on this, but the last step that he talks about is troubleshoot and iterate and expand. So again, it's just you build this for a while, and then once it's embedded, then you can expand and keep growing that habit into that bigger dream that you had, and makes it sustainable. So I think we're out of time, but yeah, again, just please, if you can, we just really recommend tiny habits, and it's really benefited us. So it's there on Amazon. I don't know, honey, if you want to say anything else.
No, I'll put this slide up for just a couple more seconds, and then the next one. And I think that was all that I had to say.
Yeah, and I think all these kind of things can just help not only patient caregivers, but just in everything, right? Just like at work and everything that we do.
Thank you both so much for sharing this with us. I think so often, as caregivers and just busy humans in general, we really take on the all or nothing approach, especially when we're tired. So it's really good to kind of remember that we can be successful with things that are tiny it feels attainable. So thank you both for that. And also thank you both for the work and sacrifice that you both take on in order to make this happen for all of us. It's really appreciated. So thank you so much. So our next segment is an introduction to informing families and life course tools, which can help you and your family explore and design your vision of a good life. And to present that to us is Crystal, and I'm going to try to pronounce her name. Is it Perlberg? You may have to correct me on that. I apologize.
Krista Perlyberg.
Thank you. And you are the family coordinator of informingfamilies.org, and you are also a joy to visit with. And I felt very inspired, and just, it was so nice to connect with you in person this week. So thank you for your time.
I really have enjoyed the Rare Disease Fair this year and have met some fascinating, hardworking people. I'm here to share about informingfamilies.org, a website provided by the Washington State Developmental Disability Council. The Washington DDC advocates for better services and supports for people with developmental disabilities and their families. Our job is to understand the needs of people with developmental disabilities and their families, and to figure out ways to improve the system so that it supports people to live successfully in the community. The Washington DDC Informing Families Project meets people within their community with support and information, and also shares real-life stories with the Washington DDC community partners. We have a dozen coordinators throughout Washington State. InformingFamilies.org provides trusted news and information to individuals and families that empowers them to be active participants in planning and building a network of support and opportunities. We cover the whole lifespan. On our website, you will find the front page can be navigated by different ages, and on the left side in the tab menu, you can reach the news page, which shows the newest information, or you can access many different topics of interest. I'll put a bunch of links in at the end. I'm going to focus on tools you can use to help plan and create a good life for your loved one, integrating supports and having a vision for the future. These are called life course tools. And so that's another website that we bring in to Informing Families. It's a national organization, and Informing Families was developed through something called Community of Practice. And it's a whole thing. So we'll just go with this. These are called life course tools, and they're from the Charting the Life Course framework. Informing Families believes living a full life involves so much more than services and systems. It's about relationships, community, and growing throughout all stages of life. Rather than view a person with intellectual or developmental disabilities as wrapped in services, we see the potential of individuals rooted in community, resources, and supports. Services are an important part of that vision, but they are not the sole focus. The folder seen here was originally developed in Missouri to connect families with needed information and supports. Informing Families of Washington has adapted the folder to provide Washington-specific resources for families. The folders and framework now provide quality information, support, and assistance to navigate a full life. This slide shows that a services-only model often leads to a labeled life, a dependent life, a life of isolation, a life of poverty, and it is often deficit-based. And that's not the kind of life I signed up for, nor want for my loved one. Most people want this kind of life, a meaningful life, a full life, a good life, which may include a home, relationships, education, savings, things to do, hobbies, choices. Another visual to see this concept defined is this one. In the first circle on the left, a person is part of a family and a community. In the second circle, with the best intentions, added services often separate the person from the family and community. For example, before I understood how to have a caregiver in our home for my child, the caregiver would come and I would hide out in my bedroom. But when we incorporated the caregiver to help our daughter participate with the family as a whole, and then I got to feel like a mother and not just the caregiver myself. In the last diagram on the right, we see important services and supports as little stars that are there to help the person live within their family and community and not separate them. The core belief of the Life Course framework is all people have the right to live, love, work, and play, and pursue their life aspirations just as others do in the community. In this diagram, the principles are drawn out to show how integrated supports and services are available to support positive life trajectories across the lifespan, shown by the circles on the bottom. The circle on the right represents a good full life supported by integrated services and supports, and I will show you some more tools that help you do this. These are the key principles of the Life Course framework. They include focusing on all people, recognizing that the person is in context of their family, the trajectory of life experiences across the lifespan, achieving life outcomes, life domains, 3 buckets of need, the integrated support star, and the transformational policy and systems change. You can find these on lifecoursetools.com, but I'll show you some more examples. To understand the idea of integrating supports beyond the services model, I'll offer this example of the principle of focusing on all. Looking at the triangle on the left, this example is in the field of public health, which has worked to solve the problem related to the spread of infectious diseases like the flu, using many different strategies and ideas. We know that if everyone contracted the flu, the medical system would not be able to treat everyone who came to the hospital. It simply doesn't have the capacity. The public health field discovered that the flu shot is very successful in preventing its spread and lessening its effects, and now promotes this widely as an intervention. Many communities have embraced and accepted ownership of the intervention, so you can now easily get the vaccine almost anywhere, including a clinic or even your grocery store. But even more impactful was more impactful than the flu shot is an intervention that is picked up by our culture, simply washing hands with antibacterial soap. Now, antibacterial soap is in restaurants, public spaces, and is most likely in your bathroom right now. The innovation has single-handedly done the most to prevent the flu. Now, on the right, supports to individuals with intellectual and or developmental disabilities and their families can be viewed using the same approach. While we know that the current state systems of services and support simply are not set up to serve all families who need assistance, we can look to the disability community to fill the gap with support groups and networks like Informing Families that are geared toward providing information and opportunities to connect with other families and through existing family and self-advocate networks. At the same time, we know that the most effective way to provide supports to individuals with intellectual and or developmental disabilities and their families is by offering them the same access to resources and supports that other families have. For example, in community, even though we don't usually think of going to a place of worship as a support or intervention, the idea of going to your faith community for support when you need it is commonly accepted in our culture. The next principle of supporting persons is the 3 buckets of need, where Informing Families' mission and work can be seen the most on their website and through the work of our information coordinators who bring information into their local communities. The 3 buckets of need include the bucket of discovery and navigation, which are skills, information, and tools to navigate a life. The second bucket is connecting and networking with which are self-confidence, strong mental health, and connections to family and friends, peers, and others. And the third bucket is goods and services, which include things you buy or use or access in your day-to-day life. People need information and connections. The Life Course tools can help families see what they already have and what gaps exist and possibilities to fill those gaps. And this information is needed in every domain of life, which is listed on the left side of the slide here. And all this information, I always say, is on the lifecoursetools.com website or the informingfamilies.org website. I'll provide those links later. The domains of life defined by the charting the Life Course framework are meaningful day in employment, community living, safety and security, healthy living, social and spirituality, and advocacy and engagement. And the information and connection is needed at every stage of life, which are listed on the right, from infancy to aging older, getting older. Looking into another principle of the Life Course framework, we can see. If we focus on the person in the context of their family and also in the context of their community. The person is the individual with the intellectual and or developmental disability, and you see the person within a family, whatever family means to them. Informing families plays a strong supporting role for individuals and especially with families. The Life Course tool for mapping relationships is a phenomenal tool to understand who cares about your loved one and who would care for your loved one, especially in your absence. And understanding the reciprocal role your loved one plays in others' lives is also quite meaningful and very enlightening. I've found this exercise to be super important. My favorite principle and Life Course tool is the trajectory. It asks two very important questions. What do I want for my loved one, or your self-advocate for yourself? And most importantly, what don't I want? Sometimes it's much easier to say what I don't want, so to figure out what I really do want. The Life Course framework offers this tool in various formats. In this example, the last column is filled out first, describing a vision of what the person wants and doesn't want. The first column is for recording current positive and negative experiences that are leading to or away from the vision of the good life. The center column is for current or future experiences that will help this person go towards their good life vision. Not all boxes have to be filled in. These tools are very dynamic. You can use them however it fits your needs. So let's look at the integrated star. How can we use the integrated star to help a person go for their good life? First, a little review. The stars seen in the ideal model on the right represents the integrated services and supports. They are provided where the person wants to be to support them within their family and in their community. The STAR form is probably the most recognized Informing Families resource we have after the network folders. We have integrated STAR forms for getting started, like the one on the left, to get started with DDA services, for example. And we have the integrated STAR form on the right for transition times, like for moving from high school to adulthood, as seen on the right. There's also a generic empty star form, and all of these are available for download, or you may request printed copies through our contact form on the informingfamilies.org website under publications or bulletins. The star has helped so many individuals and families see what they already have, and if and when they need to rely on paid services. There are many hypothetical examples of star forms on the lifecoursetools.com website. This one here looks at respite support options, and not only includes eligibility-based supports, but also the strengths of the person, technology they can use, relationships they can access, and community-based options, which all provide many more options for the person's good life. This example can be found on and downloaded off of lifecoursetools.com. Another version splits the integrated star into current skills and future needs in each support area for the goal listed in the middle. In this example, the goal is this person's after-school needs so the parent can return to work. It describes the teen's current strengths and abilities and what the teen may need to learn, what relationships they may be able to help, what technology could be used to help the teen stay home alone, what community programs are currently used, and what community programs may be possible for the teen. And then the last point on the star on the bottom right is the eligibility resources are explored. Using the integrated star with a daily schedule can provide useful information to designing a full and good life for a person. A good day for a person. In this example, this calendar shows Ben's support services, which are only his parents and his waiver paid person. They are the only ones filling in Ben's day. But by going through the integrated star and looking at each point on the star, they were able to integrate more of his relationships, technology, and community supports. Ben's calendar got much more varied and full. By seeing his strengths, Ben was able to be home alone briefly when he could use his technology to keep him busy, and he now has support to volunteer at the fire department, and he has more outings with friends and other family members. This example can be found on lifecoursetools.com. Charting the Life Course framework provides many tools to support you or your loved one to have a full and good life. And when we use life course tools to see what is already available and what is needed, we can empower our loved one with integrated supports to have that good life. These are some of the tools on lifecoursestools.com and seen throughout informingfamilies.org. If you would like more information or help with creating and planning a good life that is well supported, look through our website and feel free to contact us by the contact page on informingfamilies.org. If we have time, I'd ask everyone to pull out a piece of paper and put 2 circles on the right, and then the top circle say what is the vision I have for my child or my loved one or myself. And the circle on the bottom say, what don't I want? And then if you draw a line from left to right, an arrow straight up to the vision you want. And then you could fill in later what you're doing now that helps lead to that vision you want to see for your person. So I think I was kind of nervous. So I went really fast.
Thank you so much for sharing.
Good. Thank you. Thanks for having me. And I've appreciated the whole conference. It's been wonderful. Thank you.
Good. Well, that means you have to come back.
Oh, I hope so.
We've got you in now. Hooked you in.
I think so.
Thank you. So we have one more presenter, and I am extra excited to be able to introduce her. Michelle Hagerstrom is a BSN RN who has been working in pediatric nursing for 10 years. And while she was working at Ashley House, she discovered that she had a passion for helping medically complex kids. And in 2020, she joined the team at Mary Bridge Children's Hospital as the RN in the complex care clinic. And my son, Owen, has had the privilege of getting to have Michelle be his nurse. And I, as his mom, have been able to partner with Michelle on so many initiatives to continue to grow what is really an incredible program at Mary Bridge. And I often, when I meet with other families, tell them about all of the amazing things that are happening. And I was so incredibly grateful that Michelle was willing to give us some time today to be able to speak to a larger forum of people about the work that she's doing. And I will say that since 2020, I feel like she came in and was such a great listener, and she took it all in. And now, Michelle, you are a machine that is just attacking every one of the barriers put in front of families. And you are our voice, you are our backbone. And, you went from working in the complex care clinic to now, and I have to read it all because there's too many to remember. She's currently the nurse manager supporting the complex primary care, palliative care, and PMNR clinics at Mary Bridge. So without further ado, I present Michelle.
Well, thank you for the very, very kind introduction, Lindsay. And I really just want to talk a little bit about some extra layers of support, complex care coordination and palliative care, which I do have the honor of leading those programs at our hospital. I want to talk about complex care coordination, pediatric palliative care, and then just a few minutes for question and answer. I am also a huge Star Wars nerd, so I'll throw that in there too. So my hopes for today are just to share some additional options of support that may be available to our rare families, our patients and their families. So we'll talk about the complex care coordination and pediatric palliative care. And then I really just want to acknowledge and appreciate all of the amazing rare families that I get to work with, but just all of the speakers and all of the wonderful people that I've gotten to hear today and yesterday and meet. Just phenomenal. So I feel inspired and humbled. So this diagram is not to educate you, but just to know that you are seen and all of the roles that you play in your daily life of just being parent and nurse and social coordinator and appointment coordinator and advocates and transportation and, interacting with insurance companies and squeezing in friendships along the way. So I know that it is a lot. Everyone that I have met does it with such grace and humor. And this is Courageous Parents Network, you probably are all very familiar with, but it is such a great resource, I think, for families and for us as clinicians. And I refer everyone that I come into contact with to Courageous Parents Network. But this quote, I think, really is one of the things that is such a commonality amongst all of the families that I get to work with. And so I just wanted to read it and just, you know, just acknowledge the massive amount of tasks and things that just the many moving parts that you guys juggle every day. And it's just, I wish they knew I live in increments of time dictated by a medical care schedule. I mark my days in terms of care to be done, medications to give, pumps and infusions to manage, and medical issues to coordinate, not in minutes and hours. As interventions are adjusted, I fear the impact those changes will have on my child's already difficult life. So when I make a big deal over a little thing, this is probably why. And whenever I have a new team member or anybody that actually will just, give me an audience, I send this blog to them just because I feel like in healthcare, it's really easy for us to be disconnected from all of the things that happen outside of the clinic and outside of the hospitals and outside of when we are seeing our families. So care management and care coordination. It is one of my favorite pieces of my job. And so at Marybridge, we have a complex primary care clinic, and it came out of recognizing that children with medical complexity, their medical management and care coordination needs are beyond those of typical children. And so our goal is to provide accessible care, coordinated care, and comprehensive care. And our patients, when I looked at our panel, we have 151 patients. Our patients have an average of 90 healthcare related visits per year. And I know that's not a surprise to you. And, and when I was calculating this is not including the pharmacy visits and phone calls and my chart messages and triage calls and appointment scheduling, DME, insurance, all of those things. And so really, I always try to advocate and have people understand that, there are so many moving parts that are happening all of the time. The kids that we see, our eligibility criteria, our children have 3 or more major organ systems involved. They get care from 3 or more medical or surgical specialists, not including behavioral health. And they either have an unplanned hospital stay lasting at least 5 days or a minimum of 10 specialty clinic visits in the past year. And each complex care program will have different criteria, and they're all very unique. This is the eligibility that we're working with right now. And I think just by looking at that, these kiddos are the expert level users of our system. And if there's a gap, our families will find it and communicate that to us. And it's a great, I appreciate all the feedback and all of those areas that we get to see that aren't working and, work to make them better. So if we just kind of look at the primary care model, standard primary care, you kind of go in for your annual preventative visits, immunizations, sick visits, and help with school forms. And then there's also consultative complex care programs out there. And I think Seattle Children's is starting one, or it's in its infancy phase. And the original clinic that we were started after our program is in Wisconsin, and they're consultative. So they don't do the primary care services, but assist with school forms, do what they call review all visits, which is where they come in twice a year and just review all of the systems, all of the specialists, are things working together. And then usually these programs will also complete what we call a shared plan of care. And that is a plan that's created with families, and it really is a comprehensive resource meant for families to use out in the community, but also for the healthcare team throughout the system. So inpatient, outpatient, specialty visits, all of those things. And it's meant to be a living document. So it's changing and updating as our patients are changing and their needs are different. These clinics also will provide care management and care coordination, and then also usually do inpatient courtesy visits and coordinate with the hospitalists, which can be very helpful just to give some background on our patients and families. But an ICU doctor that's seeing them for the first time is not going to necessarily know. And then also coordination with the inpatient care managers as families are getting ready to discharge home, being that liaison, but also that follow-up resource for when families get home. And so our program, we are very fortunate. We get to wrap all of that into one place. So we get to see our kids and families for sick visits, preventative visits, their review alls, and then our lead physician, does his courtesy visits in the hospital. And sometimes that's just even just stopping by to check to make sure that, you guys are doing okay. And then also providing additional insight and background to our inpatient providers. So the shared plan of care, and listening to Ryan earlier with the Mijo app, this is really like this is like the medical healthcare institution version of what he has created, and it's that app is amazing. I'm super excited to learn more about that. But so with our shared plans of care, it's usually a 60 to 90 minute consultation with our provider, our care manager, our care coordinator, social worker, and it's just a time to have just a long conversation about your family, what's important to them, your child's likes and dislikes, and a lot of those things like, do they like high fives? Do they like to be touched? What are the things that we should not do as healthcare providers? And then we also incorporate all of the DME suppliers, all the vendors, everyone that provides services to the family, so that you just have one resource, one place that you can refer to all of these things, for all of these things, and also to provide to daycare or the school, or anyone that out in the community that would be needing to know this information. And then we also talk with you about goals and what are some things that you would like to see for your family, for your child, and they're all different, just depending on what's important to you and what those milestones might be for your child or your aspirations. And sometimes it can just be things like, we want to be able to spend more time outside, and my child has trouble regulating their temperature, and then our care manager went and researched and found a cordless electric blanket that holds a charge for 5 hours. So just we want to look at all of the things and see how creative we can be in helping find solutions, so that you can just be parents, be a family, and live your best lives. One of the other things that we have created along with our shared plan of care is what we call our yellow card. And it's just a card that we use to highlight all of the very, what we feel is the most important medical diagnoses or conditions, things that someone might need to know very quickly. And I think this comes up in the emergency department frequently, where the triage nurses have 4 to 6 minutes to triage your child. Most of our kids have very large medical record files, and they are not going to be able to read through that in 4 to 6 minutes. And so we provide this card to our families that's laminated that they can just keep in their to-go bag or take a picture of it, have it on their phone, where they can utilize this as a tool in different environments that will hopefully help just communicate some of those really important pieces very quickly to people that need it. I will say it is still a work in progress on where we can put it in Epic, where everyone across the system would be able to access that. So all of our programs are definitely works in progress. We always have room to improve them, I think. So one of the other programs that I get to support is pediatric palliative care, and it has had a journey at Marybridge. We had a really great, robust, strong program that dissolved for a few years, and it has recently been restored thanks to a lot of family advocacy. So thank you. But pediatric palliative care, and again, this will look different at every hospital. But overall, in general, pediatric palliative care, it is not end-of-life care. It is care that seeks to improve the quality of life for children with life-threatening conditions as well as their families. So it's interdisciplinary care that addresses physical, psychosocial, and spiritual concerns or suffering, and it is available at any stage of disease. And that's something that sometimes you have to educate your medical team about. That is, it's evolved a lot in the last, I think, 10 years. So who can be referred to palliative care? Any patient with the presence of a life-limiting or life-threatening condition, chronic or complex illness, particularly if there are frequent or prolonged hospitalizations, if there's difficult decision-making to be made, or maybe in the future there might be some difficult decision-making that will need to be made. Concerns about baseline quality of life, caregiver burnout, conflict regarding family goals, and sometimes that can be within the family, and sometimes it is with the care team and the family. Communication challenges. So there's a lot of, I think pediatric palliative care has a very wide berth, and in our program, we always want to meet families the sooner the better, because we want to be along the journey with you and have the opportunity to develop that relationship and get to know you and see you and your child and your family as a whole unit and as a whole person, not just a diagnosis or what medical interventions are needed. And so what we do is we really look at personhood. We look at the illness experience. What are your hopes and worries? What are your values as a family? What's most important to you? Your goals, quality of life. What does that look like for you? What does that mean? And is the care that you're receiving, is that in alignment with all of these things, with the quality of life that you're wanting for your child, with your family's goals and values? And then just offering support and really creating a space for where there really is no agenda. It's really just a space for you to maybe just take a big sigh and just sit with all of the things that you juggle throughout the day, over the last months or years, and just having a space where there really is no expectation, but just to be. And you'll see I like this diagram a lot because I feel like there's always so many moving parts. There's always so many things going on. But palliative care really kind of touches on all of these different areas. So looking at culture, looking at physical symptoms, advising for symptom management, working with the other specialists to, if there's a point of distress or a physical symptom that is just really persistent, consulting with the care team to try to alleviate those. And I have found in watching our palliative care provider that she often will come at things from a very different angle because she is she's not involved in one particular system or specialty, and so she's really kind of standing back and looking at this whole picture. And so it's interesting to see that. Social health, bereavement, legacy, ethics, helping to navigate through the medical system, helping to provide support and care for the caregiver, advanced care planning, conflict, hopefully conflict resolution, communication, just really being there along the way. And this is, I think, my favorite graphic or visual for what I feel palliative care is just really, helping to just pull apart those little pieces and hopefully to give some order to them, but also just to give that space and that time maybe for you to take a breather and be able to sort through some of those things as well. And so then really just a couple of resources. And if you're not familiar with Courageous Parents Network, highly, highly, highly recommend. And my contact information is here, and I am always happy to talk or email or Teams or WebEx or any of those things anytime. I feel like that in my conversations with my families that's how I know that I'm doing the right work, that we're doing the right work, and that we're, really making a space for you that you should have in the world, but certainly at a children's hospital. So thank you. Thank you for letting me jump into this bucket of phenomenal human beings that I have gotten to watch today and yesterday. So appreciate it. And I'm happy to answer any questions, or you have my contact information, and Lindsay has it too. So if you didn't catch it before I close that slide, feel free to reach out.
When somebody goes about figuring out, who is that person that navigates that care? What is that title? Is it, is it a nurse practitioner? Is it, who's part of the team of a palliative care clinic?
That can vary. There's usually a provider, either an MD, can be nurse practitioner. Usually they have a social worker on their team, and usually a nurse coordinator is the other is the title that usually nurses have in that role.
What do you recommend as the first, how people is it that it could be any of those, or do you think people should start with a certain how do you reach that kind of person, I guess, within, how do you go about it?
Organization. You can ask any of your specialists or primary care provider for a referral to palliative care. And they're, depending on the organization, they'll have different criteria of who qualifies for palliative care. But that would be the first place to
yours
start.
is so expansive of your criteria. So I'm just wow. And so is that normal? Is it normally this expansive of your criteria? Because I'm ding, 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 wow.
Yes, some programs are
okay.
Kind of wide open, like we are. Some programs are more inpatient based, and but I think that they're also starting to expand more out into the outpatient world, because ideally our families are spending more time outpatient, out of the hospital, than they are in the hospital, and so wanting to really make sure we're supporting our families wherever they are.
So So my understanding is that you're saying to get this started in your hospital, for example, you want to kind of start, and I'm just talking from different people from different states too, like just who do you start to talk to first? It sounds like just sort of whoever the palliative care team to see, is that kind of a good starting point then? And is that, or what are your thoughts?
I think it's a good question. You can certainly reach out directly to the palliative care team. I have found that palliative care people are super, super nice. They're like wonderful human beings that they're so nurturing. And when I went through the pediatric palliative care program, like we would have these workshops and I just didn't want to leave because for like 2 days you were just talking to all these people that were like safe and kind and nurturing. And it's like, I just want to stay with you guys. But so that would be a really great place to start. And then if there isn't a palliative care program, then call Lindsay because she's really good at advocating to get one. So, but I think I feel like anything that I work on, or that we have worked on as teams is it's like continually asking and just asking everybody so that it just is like, it's just a theme that they just can no longer ignore. And finding those champions.
But because you have so I guess I have another question. I'm sorry for all my questions, but is there a difference between then your complex care versus your palliative care?
Yes. So our palliative care
within the complex care?
It is not. It's its own separate clinic.
How does that work? Do they not work together?
They do work together, but they are considered separate services. So there are lots of kids that are on palliative care or receive palliative care services that are not in the complex care clinic, like our oncology patients or just kids that are seen in different parts of our system. Most of our complex primary care kids are enrolled in palliative care.
I would also say there's a large amount of children, I think, that are probably receiving palliative care who have, they live kind of away from Mary Bridge where it's located. So maybe they have their own primary care physician or they have siblings and they all want to stay at one location.
There's a lot of crossover, and I think both of those programs really do support each other and complement each other, but they're not necessarily one and the same.
So, okay. So what Lindsay was saying, I guess, like if you have a primary care somewhere else, then it makes more sense to do you not do the complex care then with Mary Bridge, and then you could possibly still do palliative care? Is that kind of what you were saying, Lindsay, about?
I think there's lots of different options. Some of them are personal preferences. And I think that there are, different criteria because as Michelle said, they're different programs. So, one may be a good fit for palliative care and not the other, or it can be very well blended and do both. So I think there's a handful of reasons that different families do it differently. And, the one thing I have to say about not just the palliative care program, but I think anyone that's gone through the palliative care training, I personally believe that group of medical professionals, and it can be social workers or nurses, doctors, whatever it may be that go through that training. I believe they are taught to be courageous and be truth tellers. I think so often medical providers don't know how because they have not been trained. We call it a bedside manner, but it's so much more than that. And I think that oftentimes what I want is a mom, maybe you don't have the answer, but I would like for you to tell me the truth, even sometimes when you have to use big, scary words that I really don't want to hear. And people that have had this training and that kind of have this calling, they are the truth tellers of the medical profession. And it's just, I wish everybody that went into medicine had the opportunity or was forced to do it.
They are starting to incorporate more of that education. It'll be a long time, I think. So, yes.
Well, thank you so much, Michelle. And I have a feeling that there are going to be a lot of phone calls made. So if your phones get busy and I can't get through, I'm never going to invite you to this thing again. So other than that, though, we're good. So thank you so much, Michelle, for your time.
Thank you so much, all of you, for these last 2 days. They have been amazing. I just, so much emotion, so much to take in. My heart is so full. I'm always just so inspired by this community every day, by all these people, always something to learn. And it's also just such an exciting time in science, with genetic testing, with cell and gene therapy. It's exciting to see the progress that's even been made in the past few years in mental health. Since 2016, when I launched Born a Hero, which was the first organization I launched, and in attending conferences, the amount of awareness and bills that have been passed to help our families and patients, and the numbers of people and organizations that have been developed since is huge. And so it's just been, I think that part has been so exciting to see. So I think that we can be really proud and optimistic of the future, because lots has been done and is being done right now from what we've learned during this fair too. But obviously there's just so much more we can do. We need more and more patient voices and representations everywhere. We need to decrease barriers in the processes. We need to increase access to resources and medicines, more repurposing of drugs. We need to study more than just one rare disease at a time, because there are just too many. There are over 10,000 rare diseases and over 240 new identified rare diseases every year. We need more education for physicians, for example. How do you refer a patient to get, like, sometimes they don't know how to refer a patient to get genetically tested. That's a problem. We need to address some of these educational things. We want to educate on also just educating our new generation of medical students on rare diseases. We need better reimbursement for genetic counselors, since there is a shortage too. We need to have, anyways, there's just so much that we can do too, right? But so grateful for all that has been done too. It's important to distinguish that. We all can do our part in finding ways we can work together to create, not have to recreate the wheel, because, you know, we are rare, so we need to really leverage each other's minds and abilities, right? We all have different strengths, and we can lay the path for what's coming too. We can not have to wait until the genetic testing comes and the cell and gene therapy comes, right? We can start educating on that, so that patients get the treatments and therapies they need as they become available. So we don't have to wait until it's there. We can start now. Please continue to share your stories, whether it's through the podcast, through radio, through commercial, local newspaper, with your legislators, a place in healthcare where you can represent the patient voice, wherever it is. Share your story with pharma or payers, at schools, and with your families, and we can continue to work towards normalizing what rare is. Continue again, like, to use your gifts. We always are so much more capable than we give ourselves credit for. Getting involved with the Northwest Rare Disease Coalition task forces is one way you can help. You will always be welcomed with us, and our arms will always be open. We have national projects that you can lead You can lead your projects in your state and make it your own. We'll support you. That's something we love to do. We love to empower leaders all over the country and love to watch people just take things on. We talk to states and different states in the country and hospitals. And we love this. We like to share bill language. We like to help other states with rare disease advisory councils and kind of share the language we've had for that, and for just sort of our approach for the whole genome sequencing. We like to talk about the fair to bring to other states, and sort of how we've approached the coalition and bringing our community together. We've done surveys. We love to share that. We're very collaborative, basically. So we're here to work with you. Next year, we'll be adding a new element of the fair, and I cannot wait to share this with you, actually. Lots of bells happening during this fair, and so we're just really excited for what's coming for this year. We have a lot of educational projects that we want to be working on, as far as the videos that we're creating for schools on rare diseases. We're going to want to do some cell and gene therapy education. And then we want to do some genetic testing education as well for patients, payers, and physicians. So lots of really exciting educational things happening and just projects. Thank you again to all our speakers yesterday, today, our moderators, our volunteers. We're so grateful for your time and dedication. And I'm thankful for Joshua and Max. Couldn't do this without you. It's like, I love the collaboration that exists. I mean, that's what we're about. And it's really, Max is our policy person, Joshua is our industry person. I deal with advocates more, and that's what it should all be about, right? Like this whole journey as we move forward in all our states, is that I think that's what makes the coalition strong, is that it's coming from different perspectives, and we have so much patient representation. And just thank you to Marissa, Carrie, Christina, Jesse, Emma, Megan, Annie, the rest of the team and the volunteers again. This really, like I said, it's a team effort. It's not one of us. None of this is one of us. None of it. It's all of us working together and taking a part and just owning it. Thank you to Seattle Children's Research Institute for being wonderful partners in hosting this fair. We couldn't do this without you and the AV team. Thank you to our dedicated sponsors who do such wonderful work for our community every day. I have met some of the most amazing scientists through pharma and through industry. So such wonderful minds, such wonderful hearts. We need to work together. Our sponsors are Seattle Children's Research Institute, Pfizer, Pharma, Illumina, Vertex, Ultragenics, Alexion, Mozi Therapeutics, Regeneron, Decimo Consulting Group, Born a Hero Research Foundation, the Northwest Rare Disease Coalition. And I want to end with a song that Annie created for us for rare diseases that we're going to put on our videos. I would love to just end with that message and that song, My Rare Wish, because we were going to put these in our videos on rare diseases. And so I just like to end with that.
I hold you for the first time. I love that you are mine. How could we ever know the changes that we'd face? And so teach us how to live with grace, to be strong in the face of tough times. I promise to fight hard for you. My wish is for your differences to shine through. You have changed my life for the better. How sweet it was that you chose me. I would argue I chose you, however. Now it's time to be a light. Let your journey begin.